Cause I don't give a fuck what you say. Yeah, I'ma do shit my way. So you can go kick rocks, I'ma stack bricks up, build what I want to make.
Yo, I got a lot of shit to say, so I'ma do this every day. I'll be writing things until I'm fucking buried in my grave. 6 feet deep under, but my body won't decay. Cause my messages are timeless, so they'll put them on display. Oh yeah, I rap with a certainty, I have a sense of urgency. A message for eternity, for everyone internally. I had some people burning me, but now they fucking learn to see I ain't the one to fuck with, now they looking nervously. And I don't really care what you think of me respectfully. You can kick rocks if you think you're fucking better, see. I will outwork you, turn you to an enemy. Hurt you so bad that you're gonna need some therapy. I got the motherfucking recipe. I've been cooking up hits, I'ma leave a legacy. You'll be looking small when you're standing right next to me. I'm 5'10", bitch, but I'm 10 feet.
Cause I don't give a fuck what you say. Yeah, I'ma do shit my way. So you can go kick rocks, I'ma stack bricks up, build what I want to make. Cause I don't give a fuck what you say. Yeah, I'ma do shit my way. So you can go kick rocks, I'ma stack bricks up, build what I want to make. Yeah, I'ma do it my way.
Coming out with a statement. You really changed, man, all your music and arrangement. You don't know shit, shut your mouth, you can save it. I'm the same dude that got his come up from the basement. 100 songs, 100 weeks, didn't change it. Experiments, development, intelligence, and patience. I'll do it all again, cause I never feel complacent. Let's keep the good vibes, positivity's contagious. I'm never looking back, cause I made a life that's passionate. A college graduate suppressing all his talents, yeah. He found a way to go and change, become an advocate. For taking control of your life, go out and battle. And you think you have a dream, then act on it. Get after it, get out your head and fucking capture it. You got one life to master it. Don't give up on your future, we all start losers. We're all late bloomers, gotta struggle through the sewer.
What you say? Yeah, I'ma do shit my way. So you can go kick rocks, I'ma stack bricks up, build what I want to make. Cause I don't give a fuck what you say. Yeah, I'ma do shit my way. So you can go kick rocks, I'ma stack bricks up, build what I want to make. Yeah, I'ma do it my way.
Hello. Can everybody hear me all right? Just want to make sure everybody can hear me. Hi, JL. Hey, Ginger and Hemi and Daniel. I've seen a few of you guys already in here. Thanks for being here. Of course, we are going to continue where we left off. I have a question for one of you two ladies that are in here that are my mods. Can you do the exclamation capital TIP in chat? Let me know if my stream bot is working, my cloud bot. It never gave me the correct. If you really want to know, I don't think it gave me the right link for my thing, and that's what was taking me forever to start. I cannot get it to work. I'm like, what the hell? So, because with the stream bot, others will also be able to gamble in chat. At the beginning of the stream, anybody's allowed to click do the exclamation join, and that should be able to kick you over to be able to join for the games in the gamble for the stream. I'm still learning this. I'm still trying to figure this shish out, but for some reason it is not working. It may have to be something that we'll have to go live later and play with and mix around. Oh, see, there it goes. Okay, there's Streamlabs. It worked. So try the exclamation join. See if that lets you join the game. Because I know once we start the stream, I can that I gotta add you guys to the game. At the end of it, you guys can also send like different Danielle very high sports. What's that? Okay, so that's weird. So this is loyalties. Add points to viewers. So anybody that wants to join the game, I guess that's how I add your points. Add points to all viewers. I'm still learning this. This is a whole new little vibe here. Also, there's a noise alert. I don't even know how to set that off. I set up an alert, but don't know how to do that. JL, I have you. So let me see. Add. Okay, you're in the game. And if anybody else wants to join game, now is your time where you can gamble throughout the live. It will keep you guys busy. You guys will that'll just be, you know, something else that'll keep you busy while we watch and listen to the cases. Just next up, JL. You have joined the queue. Okay. Anybody else? Ginger's just busy putting out the whole pay link. She's like, pay a bitch. Thanks there, Ginger. Anyways, so supposedly they say that if you donate to streamers through the Streamlab aspect of things, they get 99.9% of the donation. Unlike YouTube, where YouTube's getting their point, you know. So with that link there, you can donate directly to me. Then I will receive 99.9% of the donations, I guess. I don't know. Don't ask me. It's just what it is. Anyways, I'm going to refresh the screen just in case if Ginger or anybody joined that wants to play in on the games. Well, JL, you may be the only one gambling tonight. Anyways, we also have other games that we can play. I know that this is getting out to a weird start. I understand for the topic that it is. Forgive me. We're just learning. We're trying to grow this whole thing over here. You know, want to make some things entertaining for you all. So we have an 8-ball. I also have that up and running. There's a few messages that are already up there. So if you do exclamation 8-ball, I believe, you can ask the 8-ball any question you want and you will receive some sort of response. Don't know what it is, but I'm going to probably add more messages to it. I'm going to play around with it more probably tonight after the stream, however that may go. But there's the 8-ball that I have enabled. Also, slots mini games. I have that enabled. Now I just got to figure out how to get you. I believe, you know, you can play any of these games or do any of these things during the stream, but you have to do exclamation join in order to do slots, to do the slots, to do the 8-ball, to do the what else did I say? Gamble. Okay. Go back. Now I said slots, gamble, 8-ball. There's also duel, but I haven't learned anything about the duel. I've enabled that, but I don't even know that would be exclamation duel. I haven't messed with any of those settings, whatever that may be. Viewers that can build an emote pyramid in your chat. Okay. And allows viewers to trigger a combo by typing in a specific emote. Oh, okay. Well, we'll have to work on doing that. But those are what I have available. I also have chat alerts whenever anybody donates to myself or to the channel. it'll set off a alert of some sort. Don't ask me what it is because I haven't even messed with that. It is what it is. If somebody subscribes to the channel, sends a super chat, donation, charity, membership, all of the above, anything like that, that'll send off an emo of or an alert of some sort. Don't ask me what. Don't know yet. Haven't messed with that. Haven't had anything like that happen. Sorry, guys. I'm not in the StreamYard reading. Steph, are you off tonight? Right? Yeah, I'm off tonight. Yes. Does Steph know what she's doing? Absolutely not. I don't know. Feels good, man. It's all Greek to me. Listen, it's not all Greek to just you. And listen, this right here couldn't be any more true. I don't know. Feels good, man. Whatever is good, it is. It's good. Whatever's good is good. I agree with the 8-ball. Okay, so I will go back here real quick and let me see. Q. Anybody else want to join in on that? You're more than welcome to. I'll check on it throughout the stream. Yeah. I can also close down that whenever I feel like it. I feel like whenever I want to stop people from joining that for the better part of tonight. Anyway, with that being said, oh goodness gracious, I'm already winded and already done, already over with. Worked up a nice nap now. How about y'all? Do y'all agree? I don't even know. Oh, okay. So we are going to go from here. We're going to go find what we're looking for. And we're going to go into there. So I have not done any extensive going forward other than where we've all left off, where we were. Never mind that. So I have not whoa, jeez. Let's not go there. Okay. We don't want that loud ass noise in the background. Sorry, guys. Sorry. All right. So we finished with the mom's testimony. We went into the doctor's testimony, witness testify. Where she testified, the doctor. And they got upset because I guess she didn't answer a specific question the way that she did in pretrial. And so the defense was going to, they were basically throwing a fit about it. That's where we left off, I believe. But why do I feel like I just want to make sure we start at the right place. Mom testifies to the last time she's seen him alive. We did that one. So I'm still trying to figure out where the heck we were. I think we were here. I think this is where we were. So let's pause. We're going to do that. We're going to put up the volume a little bit, and then we're going to hold on. Listen, stop it. You're jumping ahead of me now, computer. Calm your horses. Just chill it all out. Tell everything. Chill out. Okay. Present screen, share screen. Guys, I have been absolutely TREADMIL. I think that's it. Yep. Share that. Ginger, if you put the exclamation join, that will help you join into the game. Same with Hemi or any of the other things. Even I don't know. Do like Jamie or JL did and hit me up with some great 8-ball wisdom, because clearly I don't have any. Anyways, here we go. I got so many tabs open. I don't even know what I'm doing. And T-Waves. I'm not even sure if it will pop up on this screen because I'm in StreamYard and not. This is all weird, okay? Seems Steph's computer doesn't listen to her any better than my kids listen to me. Listen, or my kids listen to me. Ginger, you ain't even kidding me because wow. My kids barely listen to me too. Anyways, yeah, I'm not supposed. Am I supposed to be streaming from Streamlabs? I don't know. Can you stream from Streamlabs? I don't know. Listen, yeah, don't you judge me. I don't even know. All I know is it is what it is, and that's what it is. So maybe the alerts won't work. I don't know. Anyways, let's get to the trial.
Impossibly high speeds for a kid that young because he believed the boy was too fat. Now, Gregor is charged with endangering the welfare of a child and first-degree murder in the death of Corey. The state presented video evidence of Gregor forcing Corey on a treadmill in his apartment gym, showing Corey repeatedly falling down as he tried to stand. It was really tough to watch. Now, the pediatrician who examined Corey the day before he died took the stand today, so we're going to get you inside the courtroom for that testimony.
Where did you see him?
That's where I saw him in the exam room.
Did you stay in the room for the duration of Corey's exam?
I did.
And was Corey's mom in the room for the duration of the exam as well?
Yes.
When it came time for you to perform your portion of the exam, other than the weighing and measuring, was anybody else in the room other than the people you described?
No.
And could you tell me what, if any, initial observations of Corey did you make?
So when I entered the room, Corey was sitting on the exam table. That's where he had been brought to get his blood pressure taken and his pulse and his breathing and his pulse ox. So he was sitting there, and the nurse had asked him to take his shirt off. So he had his pants on and shirt off, and he was sitting quietly on the exam table. And his mother was seated in the exam room next to the exam table.
And did you make any initial observations when you walked in of how Corey looked?
Yeah. So as a pediatrician, we rely not just on what patients say, but how they're acting, because they don't, kids don't just tell you something hurts. A lot of times they don't, or they don't. So you're always looking from the very start. How are they sitting? How are they looking? Do they look alert? Are they looking bright? Before we set an eye, before we touch a patient, we're looking for all the evidence, everything we can get. And he was sitting quietly. He was breathing easily. He didn't look in any distress, and he just looked very serious. And I'd say, kind of contained, like stoic, kind of, just very sitting.
Did you observe Corey's mom?
And so she was sitting, and she looked just very worried and concerned.
Okay. Did you observe any interaction between Corey and his mom?
Well, he would look at her, and they would just look at each other as I was asking first the mother. Now I'm going to find out from them what is the history, like what's happened, or what are you worried about? So when we call in, and she was listed as the independent historian, she was the one to give the history, as parents do, first.
Did you tell Corey anything about his visit with you that day, or the purpose of his visit?
So based on, I do give children a chance to say what hurts or what's the problem, or what happened, if it's an injury, how did you get hurt? So I did that, and he at first didn't want to say anything. Shook his head. No, I don't know. And so I explained to him that in order to help him, I had to know how he got hurt and what happened. And still he hesitated. So I said, Corey, we can't help you if we don't know what happened. And please, and don't worry, because I need to know so I can help you be safe.
And did Corey give you any response?
And so he looked at his mom, and she said,
you can't tell me what anybody else
okay.
said. But did Corey give you a response?
He did. He said that he got the chest and arm and hip bruises and the forehead scrape when he was playing football outside on the turf. And he said that his dad was teaching him how to catch a football. And when I pressed him further, that's a lot from playing football. He said he got more bruises when he fell from a treadmill.
And what was his demeanor while you were speaking with him and he was speaking with you?
Well, as he was explaining this, his mother teared up and started to cry, and then he got tearful as well.
Did you end up conducting an examination of Corey?
I did.
Did we
And
watch
could you tell me
this
what that
part of the
examination
trial?
at
We're
first
gonna know.
So
We could be just replaying something we've already watched. I don't remember where we left off exactly, but I didn't think that we were already on to today's streaming, were we? I don't think so. Listen, that's just me, though. What am I thinking? This is the doctor's, but this might be where the defense starts questioning. I'm not sure, though. Streamlabs is a challenge, girl. Yeah, it is. It's something else. Let me tell you. I don't know. Does anybody remember? Did we get past all of this one? I can't remember. Wait, we did the 227. So no, we did not watch this one because the last one we watched was 227. Because I remember last night when we quit. Oh my gosh. Oh my God, the pediatrician is crying. Yeah, I know. It's sad. Like, I think actually during this part when the pediatrician's actually crying, this is where he shows the most empathy, or and feeling really bad about it. You can actually see tears welling and starting to well up in his eyes. He's still a douche.
So I reviewed his what the nurses had found out, and he had a normal blood pressure. He had what we call a pulse ox test that tests on the finger his oxygen level. It was 98%. His pulse rate was 90, and his respiratory rate was 24. His temperature was 98.6, so it was normal, no fever. And I considered those vital signs normal for his age.
Did you go on to conduct an examination, like a general one, or ear, nose, and throat, or anything like that?
Yes, and I'm noticing here when I said my first thing is generally just look at them, and he had normal activity and normal interaction. I forgot that he said, tell me that, I don't know, I have something in my notes that you might have missed.
Why don't you show it without speaking, so you show it to the strong and counsel, so forth.
All right, so that little issue leads to a sidebar about exactly what she could tell this jury about what Corey told her about what his dad told him, which of course creates a situation of double hearsay. So that created a problem. We'll take a break right now. When we come back, we'll have more testimony from Dr. Nancy Deacon. But first, we do have this quick programming note. The defendant in the Idaho student murders case, Brian Kohlberger, turned tomorrow. 8 hours. Closing argument as to.
I'm surprised that this try to get a.
We're gonna jump over this once we get into
and causing all those bruises. It is a very, very short leap to think of the type of thing.
Court trial. We will probably start listening to these little things again.
That he was doing.
Or wait.
When I get caught back up in the case.
The jury, and this involves, again, as I mentioned earlier, double hearsay, words that were said to Corey by his father that he tells the doctor. Can she tell the jury those things? Let's get back in court.
With regard to the exception to the hearsay rule with regard to Corey's then existing state of mind under 803C3.
I don't know what that actually says about his state of mind. I don't know what that statement means. There's no clarity, and as a result of it, it's irrelevant for the purposes of medical treatment, but also the state of mind. It doesn't add anything, and it calls the jury, whoever hears it, to speculate as to what that might mean. For those reasons, it should not come in. And I would also ask to strike the portion of the doctor's testimony during her direct examination that did not come out during the prior 104 hearing, where she made a reference to consistent prodding of Corey to get additional information out of him. That was not made clear. It did not come out during the 104 hearing because we could have addressed it then. And as a result, I think it should be shortened.
Thank you. All right, so first let me deal with the new statement that I'll ask the state about the additional request. Evidence rule 803C3 provides that the following type of statement could be admissible. A statement made in good faith of the declarant's then existing state of mind, emotion, sensation, or physical condition, such as intent, plan, motive, design, mental feeling, pain, or bodily health. This typically means that someone who is presently saying, I'm in pain, my leg hurts, my arm hurts, whether made to a physician or someone else, those statements are generally considered inherently reliable. People don't typically complain about something like that at a particular moment. And every exception to the hearsay rule is based upon an indicia of reliability. So here, I briefly found the child's statements about the cause, as well as what parts of his body may have been in pain, were appropriate. This is more of a question or request made by the child to the physician. Promise not to tell anyone what I said. That's not a statement about his emotion, sensation, or physical condition. In terms of the state of mind, arguably, I guess it relates to a state of mind, but it's really more of a concern about sharing with someone. I don't know if it's particularly probative. The child was injured in football. Perhaps he thought, I won't be able to play football anymore. I know the state wants to be that. I don't want my father to know I told him I fell on the treadmill, but it's ambiguous. It's certainly beyond the scope of seeking medical treatment, beyond the scope of an existing complaint or statement of current pain. So I find that this additional statement, promise not to tell anyone what he said, should not be admitted to the jury. Again, I'm constrained by the evidence rules. Ms. Ferranti brought up the second issue about the doctor's testimony at the earlier 104 hearing was somewhat more basic, that she saw bruises and that Corey said they were caused by football injuries. And then further, he said they were caused by falling on a treadmill. Contrary, or at least inconsistent with that, before the jury, she indicated Corey initially refused to explain what happened, that she was prodding him, that she said to him that to explain that she had to know what happened in order to be able to help him so he could be safe. Corey then said that the bruises, which the doctor saw on chest, arms, head, were from football. The doctor expressed here that she had some disbelief. I'm a little unsure if she said to Corey she disbelieved him or she just told us she disbelieved him. And then when pressed further, he said he fell on a treadmill. So I just wonder, like, why didn't she tell us that at the 104 hearing? The whole purpose of doing that. So now I'm concerned that it was a result of prodding. It was a result of saying we need you to be safe. We suggest he's in danger.
All right, we're going to take a break. We'll have more of the judge's ruling when we come back. Thanks to Nima Rahmani for joining us this evening. Please don't go away. Coming up next, we're going to continue our special coverage of the Treadmill abuse murder trial in New Jersey. So keep it here on Court TV, your front row seat to justice.
And when I pressed him further,
While it's an issue,
Wait.
they want a corrective instruction against the state is obviously arguing against that. So let's get back into court as the judge continues to discuss the issues with the attorneys.
Testimony changed
Yeah.
or became more detailed in just a matter of minutes. So now what do I do about that?
Okay, Ginger.
Do I just tell the jury to disregard the whole thing? Or is there some other remedy? Or do I allow Mr. Gallucci to then cross-examine her about, isn't it true you just testified at a hearing outside in front of the jury, you didn't say that?
Okay, guys,
We
I'm
did this
gonna
last week, for instance, he
slow
would want
this
to
part
transcript
down
that and would
because
dealt with it.
this you actually
he
need
said
to listen to and understand in order to know what's taking place right now. This is where I was talking about they were having a conflict when it came to what the doctor was testifying to. This you actually have to hear, to understand what's going on in the case. So let me go ahead and back this up. Let me see.
With regard to
Conviction here, Mike. Anyone would think that is overweight and needs to run on a treadmill.
Here we are.
It just doesn't make any sense. This is a sick and twisted father,
No.
and I think we're
Okay.
going to get a pretty quick conviction here, Michael.
Yeah, I would have to agree. I think what he was functioning from was a place of anger. And I think he was taking out whatever anger he had at the
Right. You
world,
can also
at the
do
mom, at
that
whoever else was involved. He
command.
was taking it out on this poor little 6-year-old boy. It's just a real crying shame. All right, Nima, stand by. We're going to get back to court now where the judge and the attorneys are actually discussing an issue outside the presence of the jury. And this involves, again, as I mentioned earlier, double hearsay, words that were said to Corey by his father that he tells the doctor. Can she tell the jury those things? Let's get back into court.
Judge, with regard to the exception to the hearsay rule with regard to Corey's then existing state of mind under 803C3.
JL,
Thank you. Mr. Gallucci, you were just right.
JL, I added another command, which is the exclamation welcome. This will just help with, anytime that you guys want to drop anything in chat wise. I will also be adding channel links eventually. Okay.
Your Honor, I don't know what that actually says about his state of mind. I don't know what that statement means. There's no clarity, and as a result, I think it's irrelevant for the purposes of medical treatment, but also the state of mind. It doesn't add anything, and it calls the jury and whoever hears it to speculate as to what that might mean. For those reasons, it should not come in. And I would also ask to strike the portion of the doctor's testimony during her direct examination that did not come out during the prior 104 hearing, where she made a reference to consistent prodding of Corey to get additional information out of him. That was not made clear or did not come out during the 104 hearing because we could have addressed it then. And as a result, I think it should be stricken.
Thank you. All right, so first let me deal with the new statement that I'll ask the state about the additional request. Evidence Rule 803C3 provides that following type of statement could be admissible. A statement made in good faith of the declarant's then existing state of mind, emotion, sensation, or physical condition, such as intent, plan, motive, design, mental feeling, pain, or bodily health. So this typically means that someone who is presently saying, I'm in pain, my leg hurts, my arm hurts, whether made to a physician or someone else, those statements are generally considered inherently reliable. People don't typically complain about something like that at a particular moment. And every exception to the hearsay rule is based upon an indicia of reliability. So here, I previously found that child's statements about the cause, as well as what parts of his body may have been in pain, were appropriate. This is more of a question or request made by the child to the physician. Promise not to tell anyone what I said. That's not a statement about his emotion, sensation, or physical condition. In terms of his state of mind, arguably, I guess it relates to his state of mind, but it's really more of a concern about sharing with someone. I don't know if it's particularly probative. The child was injured in football. Perhaps he thought, I won't be able to play football anymore. I know the state wants to be that. I don't want my father to know I told him I fell on the treadmill, but it's ambiguous. It's certainly beyond the scope of seeking medical treatment, beyond the scope of an existing complaint or statement of current pain. So I find that this additional statement, promise not to tell anyone what he said, should not be admitted to the jury. Again, I'm constrained by the evidence rules. Ms. Ferranti brought up the second issue about the doctor's testimony at the earlier 104 hearing. It was somewhat more basic, that she saw bruises and that Corey said they were caused by football injuries. And then further, he said they were caused by falling on a treadmill. Contrary, or at least inconsistent with that, before the jury, she indicated Corey initially refused to explain what happened, that she was prodding him, and she said to him that she explained that she had to know what happened in order to be able to help him so he could be safe. Corey then said that the bruises, which the doctor saw on chest, arms, head, were from football. The doctor expressed here that she had some disbelief. I'm a little unsure if she said to Corey she disbelieved him or she's just telling us she disbelieved him. And then when pressed further, he said he fell on a treadmill. So I just wonder, like, why didn't she tell us that at the 104 hearing? The whole purpose of doing that. So now I'm concerned that it was a result of prodding. It was a result of saying we need you to be safe, which suggests he's in danger.
All right, we're going to take a break. We'll have more of the judge's ruling when we come back. Thanks to Nima Rahmani for joining us this evening. Please don't go away. Coming up next, we're going to continue our special coverage of the Treadmill abuse murder trial in New Jersey. So keep it here on Court TV, your front row seat to justice.
Kind of thing like that.
And when I pressed him further, that's a lot.
Christpher Gregor is accused of first-degree murder in the death of his 6-year-old son, Corey Michelot. Now, yesterday, the jury saw multiple videos of the defendant and his son in the building's gym. 6-year-old Corey is on the treadmill, and Gregor can be seen increasing the speed on the treadmill, really until the child. One of Corey's teachers testified that she saw several bruises. As the
Jury didn't say, tell the jury disregard.
the issues with the attorneys.
Testimony changed or became more detailed in just a matter of minutes. So now what do I do about that? Do I just tell the jury disregard the whole thing? Or is there some other remedy? Or do I allow Mr. Gallucci to then cross-examine her about, isn't it true you just testified in a hearing outside the presence of the jury and you didn't say that? Because if we did this last week, for instance, he would have ordered a transcript from that and would have dealt with that. And the real was, why? Why did she do that? Why did she not volunteer that to us in the first place?
Judge, I cannot answer why she didn't do it in the first place. I don't know if it's how my questions came across her. I don't know if it's in the context of asking about demeanor.
I honestly thought that your questions were longer than necessary.
Is this not the emergency room doctor testimony? Right here, JL? I'm confused now. I thought that's who this is. Or is this the pediatrician? I don't know. Ooh, I haven't got that far yet. I'm a little confused. Let me know.
The 104 hearing that you didn't want. That's not a criticism, but I meant you could have just gone
No,
to,
the pediatrician.
doctor, we'll get to your qualifications
Okay.
later. Did you see Corey on April
I have
1st and what it said?
the,
But instead, you developed a record.
I was
And that's why I'm
trying
somewhat
to.
troubled that her answers were different before the jury than they were outside the presence of the
I was trying to, so that way anything that needed to be on the record.
than what
Sorry,
it
I
said.
was talking over him. I will try to, I don't know. I don't think Court TV has it uploaded yet. If they do have it uploaded, I'll have to check and see.
That your questions were longer than necessary at the 104 hearing that you didn't want. That's not a criticism, but I meant you could have just gone to, doctor, we'll get to your qualifications later. Did you see Corey on April 1st and what it said? But instead, you developed a record.
I
And
was
that's why I'm
trying
somewhat
to.
troubled that her answers were different before the jury than they were outside the presence of the
I was trying to, so that way anything that needed to be on the record could be on the record.
And
And
that's
as far as,
commendable, and I would say I appreciate you for that.
As-
My comments are not critical of the prosecution at this point.
as far as what she said to Corey, I was trying to bring that out in a chronological way. And what she said to Corey wouldn't, be part of the 104 hearing about his statements. And I think when she told me things, it was a little jumbled. And I don't know if she appreciated the significance of that possibly, instead of it being occurring at separate portions like I was trying to do at the 104 hearing. And I also asked about his demeanor. I think I followed up with that question, which may have caused her to say it the way she did. I can't speak for her, but that is why I did try to conduct the 104 hearing the way that I did, so all of it could be fleshed out.
I don't think your questions were remarkably different between the 104 hearing and her testimony before the jury. And I don't think anything you did as a prosecutor was trying to limit or avoid something coming out of the 104 hearing. I think her testimony was different, and that was her own doing. So what's the defense suggest I do?
Judge, I believe in order to be fair, if the court is willing to strike that portion of the testimony, or as the alternative that the court suggested, allowing us to cross-examine the differences in the 104 hearing. And just to clarify, if the court would strike all of the testimony from this docket or allow us to impeach her through the 104 hearing testimony, if we can make reference to it, I think either of those would be acceptable.
All right, so anyone else, Luigi?
I personally would rather strike it, than allow me to cross-examine her on it. That would be my first preference.
All right, so, facts and circumstances of the case. So as a general proposition, I find that what the doctor described is virtually common knowledge. You come to a doctor, the doctor elicits a history from you, or an assistant does. For a child, it's very common that a history is elicited from a parent. It's common that physicians ask
I'm over here yelling or
patients
talking to you
complaints of
guys.
pain.
And you guys are not even hearing me because I just realized I was muted the whole time. Thank you. Anyways, my dumb self. I was saying I had, if you guys noticed, I had turned down the volume on the voice booster because at this point, okay, this channel has several court TV doesn't have up. Okay. All right. Thanks. What was that? I was saying that the defense attorney is about to go ham in on this pediatrician. So if you guys have an earbuds or anything, I have turned it down on my end, but you may need to turn it down a little bit more. But this is your warning, your poor little ears, okay?
And that they also elicit the cause or origin of that pain. So all those things are appropriate. I also think that it's common knowledge that children are sometimes reluctant to say things. In the interest of this trial, I think the jury is smart enough to be able to make its own credibility determinations. Jury's seen the treadmill video. It's very, very likely the child has some bruise or abrasion from it. So that's not particularly shocking to the jury that the doctor observed these things. So I find it will be inappropriate for me to strike the doctor's testimony, and I declined to do so. In terms of whether or not Mr. Belushi then cross-examines the witness on the fact that her testimony was different at the 104 hearing than it was in front of the jury, that's somewhat problematic. There's no transcript from it because it just occurred. You could perhaps try to handle it, but what I was thinking was similar to the limiting instruction on statements of defendant. I would give a limiting instruction to the jury at the conclusion of this doctor's testimony that there is, for their consideration in this case, oral statements allegedly made by Corey to the physician. Normally, hearsay statements are not permitted into evidence. However, statements made in good faith, and I try to track the evidence rule, statements made in good faith of a person's then existing sensation or physical condition, including complaints of pain, as well as statements made in good faith for the purposes of medical diagnosis, describing medical history, past, present symptoms or sensation, their general inception, or their inception or general cause are admissible. And then to give that same instruction in considering whether or not Corey actually made these oral statements, you should consider and weigh this evidence with caution. You should take into consideration all the facts and circumstances, including whether the doctor prodded him to make any statements. If after consideration you determine these statements were not actually made or they're not credible, then you must disregard them. If you find the statement was made and all or portion is credible, you give what weight you think to that portion of speaking you find to be truthful and credible.
In addition to me being able to cross-examine her.
I think I need to give a limiting instruction, period.
Yes.
The question about the cross-examination, though, is what are you going to do when she says no? I said that I was the same both times. So you're going to ask for a readback or
I'll ask for feedback.
All right, well, we should give the court reporter some time to look that up rather than just.
I understand that.
Madam Reporter, is that something you can do?
Sure, I can do, just have to, we'll go for record, you can, a little bit.
All right, so that's the end of the arguments there. Obviously, that was taking place outside the presence of the jury. They'll be bringing the jury back in so the doctor can continue her testimony. The judge really had three choices here. The doctor testified on a proffer of evidence. This was outside the presence of the jury. She didn't mention that she had to pick and prod to get the jury that differed, but he decided, you know what, I'm going to give a curative instruction. All right, looks like they're set to go. Jury back in. Let's go back in for more of the doctor's testimony.
Off, I was asking you about the examination of Corey that you conducted. Could you please describe the examination that you performed on Corey?
Yes, so as I said, he had normal activity and alertness, was sitting up without favoring anything. His eyes, when I say eyes, were clear. I looked at the external, everything looked normal. The whites of his eyes looked normal. I looked inside his eyes with ophthalmoscope and then into the back of his eyes, that was normal. I examined his ears, canal, and his tympanic membranes. The canals were clear. His throat was clear. He didn't have any redness of his throat. He had no signs of any viral. When I say viral stigmata, I mean he had no runny nose, no mucus. His neck, he could move it all directions. It was supple. He wasn't favoring it. And he had no what we call cervical adenopathy, meaning he had no enlarged lymph nodes anywhere on his neck. And the other.
Just because you missed the heads up, if you do exclamation join in chat, you can join in on gambling and playing slots and all of that from Streamlab games and stuff. Also, you can mess with and ask 8-ball questions and random questions and see what 8-ball comes up with for your answers. Just something to entertain you guys. If you weren't here for that announcement, just go ahead and type join in chat and I will put you guys all in there.
Other thing that I look for when there's infection is if there's tenderness over the cheekbones, to look at the sinuses, and I checked them and they were not tender, and the other sinuses I palpated and there was no tenderness. I listened to his heart and it was a regular rate and rhythm. He didn't have any murmurs. He had normal heart sounds, and his breathing, I had already observed that he wasn't breathing fast or heavy. He wasn't sucking what we call labored, sucking his ribs in. look at making any effort. He was just breathing normally, quietly. And when I listened to him with a stethoscope, his lungs were clear. And he had what we call good air movement, meaning he had a full breath in and out. And I was particularly interested because some of the I was interested in any rib injuries. In fact, I palpated all his, I had him lay down, I checked his abdomen, it wasn't distended. When I say HSMM, he had no enlargement that I could feel of his liver, his spleen, or any masses that I could feel. He didn't guard, because sometimes children don't tell you that things hurt. So I push hard, and there was no tightening of his muscles. There was nothing, and I listened to his bowel sounds, and, meaning I listened with a stethoscope, and they were normal. So everything was good with his bowels. As far as neurologic, he was alert. When I say oriented ×3, he knew where he was, he knew who he was and who he's with. Checked pupils, their reactivity, and his eye movements, all his cranial nerves. There was no drooping. Everything, when he moved his mouth, there wasn't any drooping. And then I went on to look at his muscular skeletal system. I also I noted all of the findings on his skin. I can talk about them now, or I can complete the rest of the exam and then talk about that.
Could you tell me about the rest of the exam first?
Yeah. So I wanted to make sure he didn't have any injuries to his muscles or bones. So I had him raise his arms up over his head, and he could do that. He could move them every way I wanted. He could, I had him get off the table and walk for me and jump up and down. Without any difficulty, without favoring anything. He had a normal gait. And I checked all his muscles, which for me is he has to hold him out. I've got to push him down. He's got to push me away, laying down.
All right. So then at about 5:18 in the afternoon on April 1st, Corey, the 6-year-old boy, the victim in this case, presented relatively normal, other than a few bruises. Less than 24 hours later, he would be dead. And that's the issue in this case. All right. We're going to take a break here. When we come back,
Resistance of swelling or warmth. He could took that.
This is highly unusual, frankly.
Yeah, fair. Because she was afraid of some of the bruises she was seeing on him. Let's get back into the courtroom.
Resistance of all his muscles, and so absolutely nothing that I was worried about with his muscles or his bones. He had no swelling. I had him stand on each foot, and he could spare weight, because sometimes you even So I made sure he had no problems with that. He had no swelling or warmth, anything that would suggest an infection of his skin, or any no swelling. And when I say no pain, with palpation of his chest, I push on all the ribs and all the bones to make sure that there wasn't any sign of rib or bone tenderness anywhere.
And doctor, were you making a pushing motion with your hands when you did that?
Yeah, so I'm making.
And I
your rib area that
all
you
the ribs. I
Very,
push
very bad.
every bone I can.
romantic. You can't
And
even-
up until that point, what you've testified to so far, did you make any findings or discover any problems?
No, and then I did check his genitalia, and there was nothing, no problems or
try hard.
masses or abnormalities there as
Try
well.
hard.
The abnormalities that I saw were on his skin.
And did you document that anywhere?
Yes, I did.
And where did you document it?
I have a body, I used a body chart because to be able to show and be able to remember where I saw any lesions on his skin.
Judge, may I approach the witness?
Sir.
Dr. Deacon, I'm showing you what's been marked as S43 for identification. Could you take a look at it for me, please?
Yes,
Okay. Do you recognize that?
I do.
What is that?
And this is my my body chart that showed that, and I have written down the lesions that I noticed on his body. It says it was done. I labeled it as 4/1/21 Corey Mathiola.
And when you say his, you mean Corey's body?
Corey's body. Yes.
Okay. And does S43 accurately depict the observations that you made of Corey's body when he was at the visit at your office on April 1st, 2021?
It does.
Okay. Could you take me through the observations that were on Corey's body that you documented, please.
Okay, so I'm going to start the head and work my way down front side of his body first. Present on his left forehead was what I described as pink granulation tissue with a tiny scab. What that means is that there was dry pink tissue with a little scab.
Doctor, could you
I'm
just tell me
pointing
when you
to-
point to a body part where you're pointing on
Yeah,
your
so I'm
body?
pointing to my
Ball,
left
don't know much
forehead.
of anything.
There was a blue-gray bruise over his left cheek, and I'm pointing to the bone right here on his
wonder if it
left
knows
side of his
anything.
face. Number 3 was a large yellow-green bruise, and that was located overlying his shoulder, his trapezius, and I'm pointing to my left shoulder right here. 4 was another large yellow-green bruise, and when we have the standing pose, the arms are like this, so it was on the left inner arm.
When you say it's standing like this,
I was standing with my palms facing forward. The 5th thing that I noticed or that I wrote down was a blue bruise present over the elbow, and I'm pointing to the inner aspect of the elbow overlying the bone. On 6 was on the right side of his chest, and it was 2 areas of what I called hyperpigmented skin, which was the skin was white compared to the skin around him. So for me, that means that was a healing area of healing skin where it's healed, but the pigment hasn't come back yet. 7 was my impression. The 7th was a linear scar. When I say linear, I mean like a line, and it was present on the right lower abdomen. Pink, and I called it a scar, pink scar. 8. These were superficial fresh scratches. They were located below the belly button, above the pubic bone in the center of his body. By superficial, I mean they looked, I called them fresh because you could see that they hadn't formed a scab. There was like a little bit of moistness to them that looked like a scratch that just happened or could have happened. 9 were blue bruises, and I made 3 circles, and they were located on the left lower leg, the front part of it.
To me, with the 3 different staging of bruises and healings and wounds and stuff, it's just that just shows that this isn't just it wasn't a one-time happening. You know what I mean? It's happened over time.
Overlying the shin, so the area where the bone, you can feel the bone on the lower leg. And then 11 and 10 and 11 were what I described as tiny scratches on the lower front of his ankles, between the foot and the lower part of his leg.
All right, he's an active 6-year-old boy. There can be some bruises. That's a lot of bruises for one boy. And if you got a lot of them playing football with his dad, something's wrong there. Shouldn't have those kind of bruises. Teaching your son how to play football. Anyway, more testimony on you.
Exactly. That would be my point, is what he said right there. Even if he got him from playing football with his dad, you're being a little rough with him if that's the case.
Aside from this New Jersey, Michael Ayala, the
child,
pediatrician, for what you see,
Overlying this,
relatively normal. Let's go back into court.
now located on the back, his back of his body. So he'd be facing this way with the palms.
Yeah, like football like that.
12 was a large yellow green bruise, and that was located on the back of his left upper arm, overlying this kind of fatty muscle tissue. And 14 was another large yellow-green bruise, and it was located at the waist. Now I'm talking about this left side right here, kind of over this upper part of the glute muscle. the soft tissue.
Doctor, are you turning around when you show
I'm
us
turning
that?
around and I'm showing you my back left side.
Is that everything that you have on your chart, doctor?
That's everything.
Okay. And were those 14
was
areas of the body
14.
that you described?
Yeah, that last one was 14. Oh, and 13. Did I describe 13? Was another bruise located on the elbow, on the backside of the over that bony process of that arm.
Was that everything you did that was part of your examination then?
Yeah, just double check. That was all that was the extent of my exam.
Did you make a plan for Corey before he left your office?
I did. So, assessment is what we do after the physical exam. What is my assessment of this Corey? And my assessment was numerous bruises with different stages of healing and healed abrasions with a history of falling on a treadmill and getting hit with a football. Mostly over bony prominences, but some were over soft tissue areas.
What was the plan that you made for Corey?
So for me, there were bruises that you could explain, by the ones over bony processes, but falling with the play that children do. There's common areas where we have bruises, and then there's areas over soft tissue that it takes more of a blow, more usually, to have that size of a bruise and that kind of injury. That's why I was trying so hard to make sure there wasn't any underlying bone or just because they were so big. And so through my mind is, well, when you have those kinds of bruises, it takes either a bigger, harder force, or he might have a reason why he bruises easily. So I had said, I want to rule out any bleeding or clotting abnormality because those children can have extensive bruising as well.
Did you make recommendations for Corey before he left your office?
Yeah, so I told mom that we needed to bring him right. He needed to go right to the hospital. That we had to be sure that he wasn't at risk for even worse bleeding, and his blood work. And honestly, from what I learned and what he said and my whole impression of this visit, that he needed further, even if
I have no idea what he just mumbled there, but if anybody is good at reading lips, let me know what he said. We'll rewind just a bit. Watch his mouth. We'll even slow it down.
Learned and what he said and my whole impression of this visit, that he needed further, even if
I don't know what he said.
the DCP&P hadn't been involved, I would have called them. But I thought I'll send him to the hospital for further evaluation because he needed more.
Looks like he wants to come over that table at that doctor.
Evaluation and expert interviewing, more that would.
It's just me that feels that way, but he did look like he was wanted to come over that table at her.
That's not my role as a general pediatrician. He needed more care before I would consider him safe to go home.
When you finished with your examination of Corey and making recommendations, did you contact anybody about Corey and your recommendations?
I did. So I called, this is now 6:45, 6 o'clock, it's getting late. And so I call when I have a concern, I have a careful record, but I wanted to also let them know what I was worried about. And so I called the emergency department physician. I had wanted him to go to Jersey Shore, but with time constraints from the mother, she did agree to take him right across the street from my office, not 5 minutes away, was community hospital. So I sent him there. I called the doctor that was going to see him there. And I called Mark, the caseworker from DCP&P, who had asked to be called after my visit to discuss my findings and concerns.
And was that your last personal involvement with Corey Mitchell?
Yes.
Any additional questions,
I'm sure she does.
All right, so there you heard the doctor say there was enough there for her that if the Child Protective Services had not already been involved, she would have called them. The mother had already gotten them involved, and she wanted the mom to take him to the hospital for further checking up. All right, cross-examination is next. Keep it right here. We have much more on the other side. We can dive deeper into each side's theory of what pretty intense. So let's get back inside.
How are you, Doc?
I'm okay.
Good. Much so pedigree. You agree with that?
I think I have a good education and
You had a BS in nursing, right?
mhm.
Where'd you get that from?
This defense attorney, I'm sorry, but he strikes me as an asshole right along with the guy that he's representing. Hold on, guys. I'm going to slow this down. We're going to listen to him a little bit slower.
I think I'm okay.
Good. How are you, Doc?
I'm okay.
Good. What's some pedigree? Would you agree with that?
Yeah.
I think I have a good education and
Yeah, it's almost like it was saying, that's you got some pedigree. It almost like, is he trying to like demean her? You know, like put her lower than like almost like bringing up pedigree. It almost to me that would be like almost ranking her in some dog class, kind of thing, instead of where she is. I mean, she's got the title doctor behind her name or in front of her name for a reason. She went to school. She got all them smarts for reasons.
Had a BS in nursing, right?
mhm.
Where'd you get that from?
Wilkes University.
Okay. Then you have a DO, right?
Mhm.
Where's that from?
That's from the University of Medicine and Dentistry of New Jersey, School of Osteopathic Medicine. At least that's what it was called then when I graduated.
And then you got a pediatric internship, right, from JFK Hospital?
Yeah, that DO, we have an internship as part of our to get your official DO. So I did that. Yep.
Now, what's the difference between a DO and an MD?
Doctors of osteopathy get additional training in the soft tissue. We're in education about the connection of the mind and the muscles and how everything's connected and influence each other and how you can treat the whole body and person.
Then you have a pediatric residency, right?
Yes.
And where was that?
That was at Monmouth Medical Center, now the Unterberg Children's Hospital, Monmouth Medical Center.
And then you even taught, right?
And as part of that, I'm a teaching attending there. And I didn't also tell you I was a teaching attending at one time at Jersey Shore as well.
So how long did you teach for?
Well, I continue to teach residents.
What kind of residents were they?
They're pediatric residents.
And how long did you teach for?
I'm continuing my entire career as a pediatrician.
So how many years was that?
So I finished my residency in 95, and I'm still teaching, attending. I'm a clinical assistant professor at Rutgers Robert Wood Johnson Medical Center. Through my work particularly with residents at Monmouth Medical Center.
Now, you're teaching them how to be pediatricians, right?
Mm-hmm.
You're teaching them how to do what you just told this jury that you do, right?
Yes.
And as a matter of fact, your administration gave you the chart, right?
Yes.
So you can review the chart.
Yes.
Right? Because the chart is important, right?
Yes.
Okay. And I'm sure when you teach your students, you tell them how important it is to put information into that chart, right?
Yes.
Can you show me in your chart where you talk about what Corey told you, that you needed to encourage him to say that he was reluctant to say that to you, that you needed to prompt him, that you needed to show him he was safe? Can you show me anywhere in that chart when you wrote it, that you wrote those things, that, by the way, I would believe are
Okay, let me start all over again. Thank you. I'm glad you caught me while you did. Hey, something to talk about. How are you? You got me watching this for sure. Sorry. I mean, well, let's blame it all on JL because she's got me into it also. So, okay. So, I was saying, okay. So, as met some of you may or may not know, I went to school back in 2014 to 2015 for my registered medical assistants. When I was doing my internship and doing my training off campus with a provider, I can't tell you anybody in the office that I worked in, and they of course let you go from one area to the next. They kind of like bounce you around so that you're getting a feel for what this doctor may do or that's different from that doctor and how they want their medical assistants to do what they do and how the differences and all of that. I can't tell you one doctor that actually word for word like transcribed like a court transcript would be, exactly what was going on in the apartment or I'm in the appointment, not apartment. Jeez, oh God, mind is, shiny things. Anyways, so in the appointment, word for word, I don't remember any doctor ever like transcribing that, So it is what it is. I think this defense attorney is just being a D. But yes. All right, let's continue.
Important in an evaluation by a doctor who is asking about child abuse. Where is it in that chart, in that assessment?
So I did not document exactly what I said to Corey.
And as a matter of fact, 10 minutes before this jury walked into this room, did you testify at a hearing in this courtroom?
Yes.
Okay, and when you testified at the hearing in this courtroom, Ms. Schroen asked you a number of questions about that report. Did she not?
She did.
And did you at any time during that questioning, before the jury was in this room, say anything about that you had to prompt Corey, you had to encourage him, he was reluctant to answer the questions? Did you say that one time?
I thought I said that he was reluctant. When I asked him, he hesitated. I believe that's what I said. He hesitated. I didn't say in the record that he hesitated. I said just what he said.
All right, so this is all about that issue we saw the judge talking about earlier. The idea that during the proffer for evidence, she didn't mention that she had to pick and prod at him to get that information out. It's kind of important information. Let's quickly bring in Deputy Public Defender for LA County, Philip Dubay. Philip, this was dealt with by the judge earlier, this idea that when in the record, as well as when she testified earlier, when there was an offer of proof, she didn't mention she had to pick and prod. And ultimately, I think the defense is right for making an issue of this because it can really sort of help this jury understand that if he's giving the information freely, that's one thing. If he has to be prompted, that suggests something else, not helpful to the defense.
Yeah.
Yeah, obviously you don't want suggestibility during a medical examination of any patient, let alone a
Okay,
child.
so we're gonna go
because it
ahead
gives
and
the
jump over
impression to the
this.
jury.
Basically the judge is gonna probably have the transcriber, the lady doing the transcripts, go back and read from the transcripts what she said. Pay attention to what she said.
The doctor's testimony that occurred earlier today outside your presence on the position of defense counsel that the doctor's earlier testimony was inconsistent with their testimony before you. Whether or not it's inconsistent is for you to decide.
So my question is, so they had her testify before the jury was present. Does this happen in a lot of cases? Or I thought it was just all done all at once, Like what would be the point in her having to testify before the jury arrives and then again after the jury arrives? Like, I guess, I don't know. Maybe that's me.
It's for you to decide.
Maybe I just don't know the workings of all the courts yet. I don't know. Every state runs everything differently, I suppose.
Had that testimony that some time ago, we would probably transcript of that. It was just today. We don't have that, so we're going to use this procedure with reporter reason.
Oh, thank you.
Thank you.
Thank you. I appreciate that, Broken.
This is a question by Ms. Schroen during this hearing. Question, Dr. Deacon, I'm approaching you with what's been marked for identification as S42. Could you do me a favor and take a look at S42 for a moment and tell me if you recognize it? Answer, I do. Question, what is S42? Answer, S42 is Corey Michelot's chart. Question, okay, and after taking some time to review Corey's chart, could you tell me if it helps refresh your recollection with regard to exactly what Corey said to you? Answer, yes, I can. Question, okay, so do you want me, answer, so do you want me to tell you what his mother said as well, or just what Corey said? Question, just what Corey said, please. Answer, Corey says that he got the chest, arm, and hip bruises and forehead abrasion when he was playing football outside on the turf. He said that his dad was teaching him how to catch a football. When I pressed him further, he said that he got more bruises when he fell from the treadmill.
So
Give reporter a minute to get back to work. You ready?
well, she does kind of mention that she had to press him further, even without the jury present. She still said basically the same thing. She had to press him forward. So whatever they were trying to catch her up in, I don't think it worked, but I don't know. Maybe you guys might have heard things differently. Anarchy, Stefan. Okay. Yes. Exactly. 100% the same indicators. Basically the same thing, maybe just a different verbiage, wording and things. And then I don't think this defense attorney caught her in what he thinks he did.
You're wonderful. Doing that real quick. Mr. Lucci.
Well, move on. You evaluated him, right?
I did.
You found a number of bruises. And you made a bruise chart, right?
Yes.
And the young man told you that he was involved in 3 different activities. He told you that.
And now, of course, like anybody else would be that somebody tried to detest or somebody tried to make look like a lie. I mean, she's a doctor. She looks very annoyed, if you ask me. I'm sure they're going for technicalities and reasonable doubt. True. That's all they got, in my opinion. Yeah, exactly. But she does look very irritated now. She's kind of giving him like the stink eye. I don't know who you think you are.
He received some bruises from playing football, right?
Yes.
He received some bruises from when his father was teaching him how to catch a football.
Well, that's the only thing that I said in my note, that he was teaching his father. I didn't have any other. I had 2 activities actually that he told me.
So, Doctor, please keep your voice up, okay? Remember, the jurors in the back of the room have to hear you, okay?
I said that I described 2 activities that he told me about.
Well, it says here, this is your report. Corey says he got his chest, arm, hip bruises, and forehead bruises when he was playing football outside on turf, number 1. He said that his dad was teaching him how to catch a football, number 2. When I pressed him further, he said he had more bruises when he fell from the treadmill. To me, that's 3.
Well, my impression, what he was talking about was playing football with his dad. He wasn't described that way, but that was my impression.
Okay.
I know of no other time he was playing football.
So, you know he fell off the treadmill.
Yes.
Okay. As you said here, now you know he fell off the treadmill.
Yes.
And do you know the date that was?
I don't know when he fell from the treadmill.
Okay. If I told you that he fell off the treadmill on March 20th and you're evaluating him on April 1st, would you agree with me that that's about 10 days later?
Yes.
If you said, did he tell you when he was playing football with his dad?
No.
Do you know when he was playing football
No.
with his dad? So let's go through the bruise chart. By the way, you're seeing him on April 1st. You didn't evaluate him on March 20th.
It's very
March 21st,
aggravating, Anarchy.
22nd.
That's correct.
You didn't see any activity he did on March 21st, right?
Correct.
You don't know if he played football in the park with his father, am I correct? You don't know if he was in the custody of his mother, Brianna, during any of that time, do you?
I don't know where he got those bruises.
Okay. So when you made your little chart here, and you identify, number 1, pink granulation tissue with tiny scab, can you tell this jury if you can attribute that to a treadmill, a fall when he was with his mother, learning how to catch a football with his father, or a football tryout for flag football?
I can just estimate when he might have, by the healing process, when it might have happened. That's
So-
what I meant by varying stages.
So a pink granulation tissue with a tiny scab, I'm not a doctor, but I would assume a scab means that it's,
It's been probably over a week to 10 days, yeah, but
Okay.
it's healing. It's a,
so on your chart, you have a number of different things, right?
Right.
And you can't tell anybody here when they occurred or how they occurred.
no, I can just say that there's yellow-green, which is later, anyone's had a bruise, it goes through stages of healing, and that would be a later stage of healing. It's hard to know exactly how long. And blue-gray are more recent. Again, several days, you can't really, I just described what I saw.
And you have actually 15 circles on your chart. Look in the middle of his chest above his left nipple. You don't have a number 15 documented.
Oh, yeah, down here, it says hypopigmented skin. Again, that's an area. And I can't say, did he have hypopigmented? I'm just telling you that it's.
All right, that's going to wrap up our coverage of the Treadmill abuse murder trial for tonight. Thanks to Philip today for joining us. I'm Michael Ayala. To our special coverage now of the treadmill abuse murder trial going on in New Jersey. I'm Michael Ayala. Christopher Gregor is accused of first-degree murder in the death of his 6-year-old son, Corey Mitchell. Now, prosecutors don't believe that the treadmill incident caused Corey's death, but they say it was all part of chronic abuse. Now, on the stand now is a triage nurse. She's at the medical center where the defendant brought Corey. This is April 2nd, the day he passed away. So let's get you back inside that court.
Calling your attention to April 2nd of 2021 at approximately 3:48 p.m. was a patient brought to the emergency room named Corey Mitchell.
Yes.
And can you tell the court who brought Corey into the emergency room?
Chris Gregor.
And ultimately, did you learn the relationship of Chris Gregor and Corey?
Yes.
And can you tell the jurors what the relationship was?
Chris Gregor is Corey's father, and Corey is Chris's son.
And where were you when you first saw Mr. Gregor with Corey?
I was in the waiting room. I was speaking to another patient at the time. I'm right near the door, speaking to.
It's okay. I was only having a conniption fit because why in the world did they only upload a 27-minute clip of today's trial? Like, how annoying. So we will get to where we get to. I do notice though that the longer the streams go, the less people come back or for a rewatch, you know. So I want to keep it a little bit short. Then I was saying that we can always come back tomorrow morning, you know, and stream for a little bit, and then to do some more catch up tomorrow afternoon, however we may do it. Just do a couple lives maybe tomorrow or whatever it may be, just so that way we can catch up and keep them somewhat kind of condensed into shorter time periods. So that way those that want to come back and do a rewatch, they can.
Another patient. I did not hear any commotion. I did not hear any urgent sound that would redirect my attention. A registrar came up to me and said, "Bill, you have to look at this." So I went over to Corey, and he was in the arms of Chris at the waiting room entrance, or just past the waiting room entrance near the desk.
Now, the first time that you observed the defendant with Corey, can you explain to the jurors the position of Corey in relation to the defendant?
Corey was over. Corey was in Chris's arms. His arms were over Chris's shoulders. His legs were dangling. His arms did not look like they had much movement to them. His legs did not look like they had much movement to him. His head was rested on Chris's shoulder. His head was difficult to, or his face was difficult to visualize. So when I first approached them, I knew that something was concerning, but I couldn't see everything I needed to see. So I was depending on Chris to convey a sense of urgency or unwellness that I did not get from him at first. It was more of a clinical description of what was going on, and I did not immediately feel I had to rush them back. I definitely knew it was concerning, but I needed just a little more information. If I saw Corey's face right away, it would have been much easier, but Corey's face was on Chris's shoulder.
So the first time that you made this observation, that would be the two of them would have been in the lobby area.
Yes.
And did you approach the defendant in the lobby area of the emergency room?
Yes.
And what immediate observations were you able to make of Corey in the lobby area?
So I went over to them, and I was splitting my attention between Chris and Corey. What I could tell was that there wasn't a lot of spontaneous movement from Corey. He was not really moving on his own. He appeared to have a lack of tone to his muscles, and there was a lot of support coming from Chris in keeping him in the position that he was in.
Did you speak to the defendant in the lobby area of the emergency room?
Yes.
And would this be a practice or a common practice to engage in something like that?
Yes.
And can you tell the jurors what the defendant said?
Chris told me that he introduced himself, who he was the father, his son, and he told me that this was around 3, nearly 4 p.m. He told me that earlier in the day, around 9 a.m., his son was dropped off to him, was with his mother the night before. He did tell me that the patient was at Jersey Shore University Hospital and had a workup and was discharged. And just a side note, once you hear that, less than 12 hours later, you kind of go, okay, like maybe he's not that sick. So, I need more information. So talk more. So Chris told me that earlier that morning, he was appeared loopy, very drowsy, and he put him to bed. And later in the afternoon, Corey was continued to be loopy and drowsy. And when all that time passed and he was still fatigued and not himself, that's when he brought him into the ER. So that's what he told me.
After you made your initial observations and you spoke to the defendant, can you tell the jurors what you did next regarding Corey's care?
Can you repeat the question? I'm sorry.
I said after you made your observations in the lobby and spoke to the defendant, what did you do next regarding Corey's care?
I continued the history taking, which is pretty standard as a triage nurse to get history from the patient. I would have spoken to Corey, but he was not in a place to speak. He was not making any sound hardly. I continued my brief conversation with Chris until there was a moment when Corey tilted his head back, and that's when I got what I needed to see to really kick up the speed on this emergency.
So where was Corey taken at that point?
He was taken to the emergency room. Once I saw that, then I rushed it. So I called, his eyes were in the back of his head. He didn't look well. He was pale. I called the charge nurse immediately after that, and then I got a room. And being that Chris was holding him well, I didn't waste time getting a stretcher or a wheelchair. I said, "Hey, you okay to go to the ER?" He goes, "Yes." And we went to the ER, 206, the emergency room.
What room did you go to in the emergency room?
Room 6.
And while you were in room 6 of the emergency room, can you tell the jurors who else came into that room?
So I already alerted help. So they were waiting for me in that room. Was various emergency nurses and our ER physician and a patient care tech.
And what, if anything, did the defendant say while you were in room 6?
At that time, now that as a triage nurse, my role was to get them to help, get the patient help. So at that time, I focused more on Corey than the conversation with Chris. But that's because that doctor, our ER physician, was speaking with Chris, getting essentially what I just got from Chris. He basically reiterated the story, how he was loopy and tired all day, and how he felt concerned that he didn't kind of shake out of that. So he brought him into the emergency room. He told him about the Jersey Shore hospital visit the night before. But he was more, I was working on Corey at the time.
Okay. And what, if anything, did you do regarding the treatment of Corey?
So we placed him on a heart monitor. Before that, we took off his clothes. That's when I noticed a bruise in his chest. And we still had to act quickly. So we put the heart monitor on him. I got an IV, drew blood from him, while the rest of the team was doing their various roles, including our physician who was talking to Chris.
What was the defendant's demeanor while you were in room 6?
While we were in room 6 was similar to when I first interacted with him in the waiting room. It was like a just, I would say it was a clinical aspect in that he was describing what was going on without much more difference than anyone else would, regardless of their role with the person. So he was conveying information, but there wasn't much more than that.
And after you drew blood from Corey, where did you go after that?
Well, Corey required a lot of attention, so we still had an emergency room to run. So I told the charge nurse, I'll take the charge phone, which handles the ambulances. You focus on this. So I handled the charge nurse and the triage phone, and I went to various things throughout the ER while everyone worked on Corey. He was like an all hands on deck type of situation.
I'm sorry, I did not hear that.
He was an all hands on deck type of situation.
Okay, I'm now showing you what has been marked as 48A. Do you recognize that?
Yes.
And can you tell the jurors what that is?
That is a video of that
Let
day.
me stop you right there. Is that actually a CD?
I'm sorry. That is a CD. Yes.
And are you familiar with the contents of that CD?
Yes.
And have you reviewed the contents of that CD before you come to court?
Yes.
And can you tell the jurors what is located on that CD?
That is a video of hospital security footage from that day.
And that would be on April 2nd of 2021.
Yes.
And that would be at the time when Corey was brought into the emergency room.
Yes.
And are you familiar with the persons depicted on this video?
Yes.
And are you familiar with the location depicted in this video?
Yes.
Your Honor, permission to move S48A into evidence and to publish, please?
Any objection?
No objection.
S48A.
Your Honor, permission to publish?
Yes.
Thank you. Now, in regard to the video that we just viewed, did you observe the defendant coming into the hospital lobby area?
In the video?
Not in the video, but from where you were located at the time in the hospital.
The day of, I did not see him until he was already in the waiting room.
Okay. And I'm now going to approach with S48B. And do you recognize this?
Yes.
And can you tell us what that is?
That's a CD.
And what is contained on that CD?
A video of hospital security footage from that day, April 2nd.
Okay, and you review the contents of this.
Yes.
And this is a following video from the video that we just saw, being S48A.
Yes.
And are you depicted in this video?
I am.
And are you familiar with the location of the video?
Yes.
Your Honor, permission to move into evidence and publish?
Any objection? Seeing none, S48B in evidence.
Thank you.
All right, so quick timeline for you folks. That's about 3 or 4 in the afternoon on April 2nd. Now remember, mom took him to the emergency room. He was discharged, Corey was, at 1 a.m., and that's the morning of April 2nd. She then takes him over to the father. So just a few hours later, that's what he looks like in his father's arms, and eventually, shortly thereafter, will have a seizure. So something happened in that time frame. And when he left the emergency room with mom, he had a clean bill of health, basically. The doctor said that there wasn't, except for some bruises, he was in pretty good shape. All right, we'll take a break. We'll have more.
So that leads one to think, what the hell happened in between 1 a.m. when he was discharged from the hospital with a clean bill of health, just some odd bruisings and healing sores, and 3 p.m. that following day, 3:30, 4 o'clock, whatever time it was, when dad brought him into the emergency room again. What happened?
Tonight on Closing Arguments, we're live from Dedham, Massachusetts, as the trial of accused cop killer.
What's the bet?
At 8/7 Central, only on Court TV.
Welcome back. We're bringing you special coverage of the Treadmill abuse murder trial going on in Idaho. Now, when we left off, the jury was watching surveillance video of the defendant bringing his son to the ER. So let's get you back to court.
It appears he got help pretty quickly when he went into the emergency room. Like, he wasn't standing there for a long period of time. And of course, I was muted. So I don't know what all you guys last heard. I said that it did appear that he was emotional while watching that footage of him holding his son in the emergency room, as any parent would or should be, you know, being that was the last time you held your child in your arms, you know, basically for the most part. It was the last day, you know, you're witnessing it all over again and reliving it. And I'm not sure if you guys heard me say, thank you for being a member for 6 months, cement shoes and broken justice. Thank you.
Now, is that you depicted in that video?
Yes.
And does that video accurately depict your conversation you had with the defendant on that day?
Yes.
And Do you see the person you spoke to that day on that video?
Yes.
And what would that person's name be?
Chris Gregor.
And do you also see Corey on that video?
Yes.
I'm now going to show what's been marked S48C. Do you recognize that?
Yes.
And can you tell the jurors what that is, please?
That is a CD which contains video of possible security footage from that day, April 2nd.
And is that another surveillance video following the previous video, which would have been taped?
Yes.
And you're familiar with that video?
Yes.
And you've seen it before you come to court today?
Yes.
And you're actually depicted in this video?
I am.
Your Honor, permission to move into evidence S48C and to publish?
S48C and evidence.
Now, is that you depicted in that video?
Yes.
And is that Christopher Gregor depicted in that video?
Yes.
And is that Corey depicted in the video?
Yes.
And is that accurately depict you?
Very good point there, Dave. You're absolutely true. That's true. That's honest to goodness truth right there. Yep.
Taking Corey into room 6 of the emergency room at the hospital. No other questions, Judge. Thank you.
Thank you. Any questions?
Good afternoon. Mr. Doyle,
Yes.
when you were working in the emergency room in 2021, were you a nurse practitioner then?
No, registered nurse still.
And how long had you been a registered nurse at that point?
7 years.
When you were assigned to triage, because you had the 7 years, I assume you had obviously the 1 year of necessary experience to work in triage.
Yeah.
And you had certifications from ENA and A patient.
Yes.
And just for the jury, AHA is what?
AHA is the American Health Association.
What about the ENA?
Hold on,
Emergency nurse.
let me get back here. Let me read this. Something is wrong and it will not let me text in the chat. So this is the only way you have to say something. Hello, Cement. It is the only way you have to say. Wonder why that is. I don't know why. You know that sometimes, I don't know. There was somebody else that was telling me that they couldn't type in my chat either. But I don't have it age restricted, or otherwise you would have to sign in under your account and verify that you were 18 years or older. But besides that, I don't know why it's not letting her. I was seeing her comment earlier too. So that's weird. And I don't think she had no reason. She had no reason to be blocked because she was commenting earlier. See right here, she said, "Hey, BB," and that wasn't a super chat. You're not using any block right here. You said you're amazing. See, I had you in chat earlier. This is so weird. Wonder why. Huh, maybe she said something with black words. That's what I'm thinking. But you know what? Maybe this will work. I don't know. Let's see if this will work. How's that? See if you can say something now in chat. Something to talk about. See if you can say something now and if we can see you now. I don't understand why it would do that. No, it's on my end, not yours. Oh, girl. Listen, I've even modded you. So I don't know what to do now. I got you. I think you were modded even earlier before, but I went through and I did some cleaning out of cleaning out the closets. We had, we got those that were modded and that didn't need to be modded no longer, or, that doesn't really come around in chat. So I'm wondering, she's not blocked. I just checked. Try to reboot your device, Dave said. Broken. Maybe that might help. Or close down YouTube, see if YouTube needs to be updated. I'm sorry. I'm sorry. I feel bad because you're having to do all these super chats to chat and talk to us, and I don't. I mean, I feel horrible. You shouldn't have to do that in order to chat. I mean, I'm hardly ever out here trying to do anything for, funds, but it happens. Hiya, I just dropped 2 vids. Ooh, are they fun vids? Are they interesting vids? Are they drama vids? Are they bad vids? I don't know. Tell me what they're all about. Reboot is my first to go to for any glitch. Exactly. Making room for bedazzled underwear. Stop it, Dave. This is a serious matter here. Let's continue.
Association.
Thank you. Now, when you first put your eyes on Corey,
Welcome,
fair to say
Mystery,
he was
by the
being
way.
addressed, correct?
Yes.
Now, you saw or talked about during your route the 2 video clips that you watched. Correct?
Yes.
Did you watch any other videos in this case?
No.
Any other videos from the hospital?
No.
I'm busy, people.
Is it fair to say when Corey got out of the vehicle, he stepped out of the vehicle?
I can't say that.
When you watched the video before, did you see him start to walk?
That did not look like that to me.
And when Mr. Gregor went into the hospital, he went straight into the hospital, correct?
Mhm.
When he parked his car, oh, sorry.
I'm going to say yes.
I appreciate that. When Mr. Gregor parked his car, he parked at the front of the hospital.
Yes.
And do you know, how long had you been working at the hospital at that point?
7 years.
And is it normal practice for a patient to park and leave their car in front of the hospital?
In a situation that's immersion, I wouldn't say normal, but it's understandable.
And at the time that you approached Corey and Mr. Gregor, did you realize that he had left his car in front of the hospital?
No, that thought didn't come to my mind.
Broken. I feel horrible that that's the only way you can chat. But if one of your mods just enter exclamation tip into the chat, it will trigger the Nightbot or the Streamlab bot. And if you actually donate through there, you can leave a message on there. I do have it pulled up. I don't know about the whole alerts. It's supposed to send an alert, but I don't know how that works on this end of StreamYard. However, I would get 99.9% of that donated amount, and it would bypass the whole YouTube thing. But it's all up on you. Whatever you want to do, however you want to do it, that's on you. I'm so angry that it's not letting you do that. Kind of drama. My heart was into them. One nice huggy type and a grr at those cheap tragedy pimps on our streets. Oh yeah, I'll have to go check them out after this mystery. But we've got lots of new fun toys that we can play with in chat. If you do exclamation join, you're able to join in on games. You can gamble. You can play slots. You can even ask the 8-ball questions. There's also duels. I haven't figured that out yet. I haven't messed much with that, but there's all kinds of different chat alerts or fun things that we can do in chat now. But there's that. And that will be available hopefully as long as I remember to make that active each live. It'll be active for just entertainment in chat each live.
Fair enough. When you approached Mr. Gregor, he had a mask on, correct?
I believe so, yes.
And you saw from the video somebody handed him that mask on?
Yes.
To the hospital?
I believe so.
I'm gonna go be
So you could hear his voice, but you couldn't see his voice, correct?
Well, it's kind of, you can see the video was looked a little down,
Down under the nose?
at least.
Do you recall seeing his lips moving?
I can't recall.
Now, at one point during the video, you actually picked up, it looked like you picked up Corey's left arm. What were you doing at that point?
So
A
I
little
assisted
bit.
the registrar, but on the wristband, and I was also feeling for a pulse.
And during the course of your direction indicated that you had learned during your conversation with Mr. Gregor that Corey had been discharged the night before from a different hospital, correct?
Yes.
So your concern lessened a little bit,
Temporarily, for a second.
because you knew another doctor had at least seen Corey
Staff, not just doctor.
from a hospital,
Yeah.
Corey, and they still discharged him, correct?
Yeah, something to consider.
Now, you made a statement, or actually spoke to an investigator on or about April 8th, correct?
I can't recall. Oh, it was here, the one before? No.
You actually spoke to
What year are you from?
2024.
I'd have to hear it. I can't recall.
Do you remember speaking to a Detective Mitchell?
Yeah, yes.
And you had described Detective Mitchell.
All right, we're coming to the top of the hour here. I want to bring back in our guest, trial attorney and law professor Joe Richardson is still with us. Joe, what are your thoughts on this one? As I mentioned earlier, manner they had the medical exam, and it's going to be.
Oh, was that really
does this get them
today?
So those two things don't jive.
Right, for sure. And so, of course, I mean, I think the prosecution probably have an answer to every question here, but this is going to be a battle of the experts. It's going to be about their believability, and does this get them all the way where they need to get? It's going to be interesting because the one expert's going to say homicide, the other one's going to say pneumonia. But if there's no evidence of that, then it's going to be a problem.
Yeah, it's going to be a problem. That causation is the only area where I think the state has to really work a little harder. All right. Thanks, Joe Richardson, for being with me tonight. Joe, always a pleasure. I'm Michael Ayala. It's been a pleasure being with you folks. Thank you so much for being with me.
All right. Well, thanks for being with us. All right. Right. Okay. I think that is all for Court TV has uploaded today. Videos. Let me see. That was that. Yeah, that appears to be all of that. Latest. And there was nothing in the live. I know up in chat. Let me go. I got to up in chat. JL had dropped to law and crime trials. Okay, let's see. Well, let's subscribe there. Kitty. Listen. Free cat. Kitty cat. Kitty. Hi, baby. What are you getting into over there? Huh? Is there something you're getting into? I know there is. Okay, guys, we are looking. One day. Describe 6-year-old's condition. Ow. Let's see. Which one? Is it this one that you were talking about, JL? I think so.
Corey arrived at the emergency room at approximately 8:34 p.m. on April 1st of 2021.
Yes.
And did Corey enter or was admitted into the emergency room at about 9:55?
Way different.
What time was Corey admitted into the emergency room for observation?
About 9 p.m.
Okay. And when Corey arrived at the emergency room, who brought Corey to the emergency room?
His mom.
You can definitely hear the difference in the sound between channels, if you know what I mean. Yes, that's the one. Okay. Do you think that Daybell will get off and blame it all on Lori and her brother? I don't know if he can get away with that. Anarchy's answer is Dave, ask the 8-ball. Maybe the 8-ball will know. Okay. I don't know, but I hope that it was all his property. Well, what are we thinking about the whole Susan Moorfield? Since her what do you think they're gonna do when it comes to her passing now that she was found? Have we heard whether or not Barry's going to trial or not? I haven't really heard much. I haven't been keeping up though, specifically looking for information on Barry Moorfield. But yeah. Anyways, Dave, ask the 8-ball. I bet you that'll have the answer for you.
And what was the chief complaint when Corey arrived?
Patient has some bruises all over the body. They want to find out where those bruises come from.
Okay. And when Corey was admitted into the emergency room, did you obtain the patient's history from his mother?
Yes.
Did you observe Corey?
Yes, I did.
And can you tell the jury what Corey's demeanor was when you observed him?
He was very
Broken. Do you happen to know what the cause of that is? You don't even have to answer me there. Don't stop paying me there. I'm trying to think of another way that you can answer me. You can always email me and we can discuss things there. But I'm just wondering, like, what the cause of that is. Don't answer me in chat. Don't waste your money on me or spending money on me. Oh gosh, you're gonna make the algorithm thinking that like I hit the jackpot today or something. I don't think so. Stop it. Anyways, Barry should get a charge with the new information. I think so too. He was guilty as hell. Either way, I don't care. Yeah, exactly. Dave, I don't know, but I hope not. But properties, sadly. The two were sadly found on. Yeah. True. Very true. Use the hashtag 8ball. Yes. Dale, I was thinking, but I wasn't sure of one of those days. Yeah. All right, let's continue.
little bit scary boy, and he afraid to answer my questions.
Objection.
That's how mystery right there.
What's the question?
It's not descriptive. He's assuming what? Corey Health.
It's overruled. Dr.
Did it work?
Thank you, Judge. Was there also a
You gotta ask
resident,
the question.
who was working that evening with you at the hospital?
She's not reliable.
And can you explain to the jurors what a resident is?
Resident they are under the training to be a physician, full-fledged physician. So they have to go through with 3 years training.
See?
She is the general pediatric resident. So she usually come to emergency room, see the case, present the case, we discuss the case.
Wait. Can we just say this 8-ball is really on one tonight. Oh my God, 8-ball, remember to block you. Stop it. Yes, I know it's on one tonight. I think it needs a pad. I don't know. 8-ball, and I didn't even read the channel rules. Oh, goodness gracious. Yeah. Well then. There's your answer there, right?
And then we evaluate her, how good she is, whether she's going to pass the ER rotation or not. That is our job.
8-ball bot
And
5 times fast.
on April 1st, what was the resident's name who was assisting you?
Wait. Okay. 8-ball bot, 8-ball bot, 8-ball bot, 8-ball bot, 8-ball bot. Did I do it 5 times? I don't even know. But I'm not going to try any harder or any quicker than that because it'll be something off the
Her name is Jennifer Sevilla.
And
Yay!
did you conduct a physical?
What did you do to fix it? What did you do to fix it? Thank you, Dave. Dave is the magic magician and he just fixed it for you. What happened? 8-ball is anarchy. Wear shades. Okay, what happened? Why did it do that? Woo, yeah, I forgot the 8. Yep, you got to do that. Is anarchy, wear shades. Yeah, you got to put the 8-ball or the 8 in there behind that exclamation. Hemi and 8-ball. Hemi, 8-ball and I are not on speaking terms. Yeah, no, he's really not. He said to update my YouTube, so I did. See? Awesome. I'm glad you were able to figure it out. I'm glad you were. Yay. That makes me so much happier because I'm like, stop spending all your money. And I restored my phone. That'll work too. Yeah. So, Hemi, try your question again in there for 8-ball.
Examination of Corey while at the emergency room at Jersey Shore.
Yes, I did.
And can you explain to the jurors what you did to examine Corey?
Okay, and after the resident presented the case to me, I went to ask that question again. I went to ask both patient and mother, do the examinations, and I discussed the mother what will be our plan for next 2 to 3 hours. And then I told the mother I will come and talk to you once all the lab results and imaging reports are in.
And how did you conduct the examination, meaning what did you do physically regarding the examination?
I did from head to toe examination, and then we marked down all the bruises, scratches in the diagram. I put everything in my chart.
Now, how were Corey's vital signs?
His vital signs are stable, and I'm not concerned when he arrived because of the vital signs are stable.
And can you tell the jurors about Corey's general constitution when you observed and treated him at Jersey Shore?
He's a small little boy. When I ask a question, he's scared. And
Doctor, I'm going to stop you there because you can only testify basically to what you did rather than what persons are saying. So can you just describe to us his constitution, meaning physically what you saw?
okay, physically, and we usually do head to toe examination. We go with system by system. So head to toe examination, we saw some bruises on the head, some bruises on the body, and some bruises on the back and legs. And neurologically, we do the cranial nerve examination. Basically, neurologically intact. He has no neurological deficit. He is active, alert, and not in distress. And any signs of failure and chest examination within the normal limit. I did not hear any respiratory distress, wheezing, murmurs, hypoxia. He has nothing. And bar abdominal examination, abdomen is soft, no signs of acute abdomen. That means no tenderness, no pain, and no heart inconsistency by palpations. And physical general examination within the normal limit. All 4 limbs examinations, motor is intact, sensory is intact, saw only bruises, scratches. Other than that, we did not see anything.
So, doctor, all of your findings during his physical examination were normal?
Yes.
Okay.
Except some bruises and scratches.
And what about Corey's lungs?
His lungs is clear, and as I mentioned before, no wheezing, no respiratory distress, no fast breathing, no hypoxia, and lungs is moving equally.
And you said that you had observed bruising.
Right.
And did the resident who you were working with document the bruising that she observed?
Yes.
And was this placed in the medical records?
Okay, let me take a look at it. Okay. We marked down all over the body, and we saw like some bruises, abrasion. The most significant one is on the chest bone area, like about 5 by 5 centimeter bruise. And the rest of them are small minor scratch and bruises on the head, anterior chest wall, and legs.
Okay, so he basically seen the same bruising as the other doctor. Wait. The answer is within yourself, PogChamp. What the hell? Are you joking? Stop it, you guys. Do you hate mystery? Oh, good Lord. Yeah, I was not watching chat to watch what you guys were asking this 8-ball. Instead, I was reading something because there was there's another one that I was looking at. You can add commands as moderators. My moderators, you guys can add commands by typing exclamation add command, and you can add a command there. You can edit a command by doing edit command. Allows mods to enable a command or unable or disable the command. There was all kinds of them that I was looking at back here, but I want to know about this whole poll thing because they got this poll thing. Sorry, we're sidebarring for a minute. They got this poll thing and it says, in these little, okay, inside these little, but that's not even what the hell it looks like. What the hell does it look like? What the hell? How would I do that? I don't know how the hell I would even make that. Okay, so I think it's inside these, but it's not those. If I was on my phone, I'd be able to find them. Wait, I am on my phone. What am I thinking? Okay, hold on. Oh, let me see. And then, so if you were to type, we're sidebarring for a minute, guys. Sorry. We got it. You know what's going to happen. Okay, cat dog, be nice. I got a cat dog fight over here, guys, and it wasn't very cool. The cat, he has his moments. I think he needs a pad with the 8-ball. The 8-ball and the cat are on one today. Oh my God, I'm going to ruin your channel. I'm not intentionally. No, I'm not intentionally. That's too far. Hey, Andy, welcome. We have chat playing with the 8-ball. We also have gambling allowed. We got it all going on here tonight. Okay, so there's these little things, and let me see. Options with all the available options for a poll or betting. So is it options? Okay, and then this little thing again. Let's see. 8-ball, what are you smoking? Are you joking, Napa? Will step, yell, kick, and scream. Not sure. Listen, Nightbot just called you a tryhard, honey. Yes. If you do the exclamation slots, but you have to join first in order to do the slot. Anyways, I'm not sure how to get the option for, but anyways, it says legend. Okay, so like one of the, it says was the most voted option of the poll with the amount or percent of votes, and result Legend of Zelda was the most voted option of the poll. That's weird. Anyways, a poll has been opened for which started should I pick? Use exclamation vote to vote. A poll has opened for which started should I pick? Pikachu, Squirtle, or Charmander to vote. I have no idea how to use that whole thing. I don't know. But that's weird. Anyways, let's get back to the case.
So did you observe any scratches on Corey's body?
Yes, I saw some crack.
Oh, then.
And did you observe any abrasions on Corey's body?
Yes, I saw some abrasion.
Now, calling your attention to the abrasion, specifically marked as 2, can you tell the jurors where this abrasion was located on Corey's body?
Abrasion is on the left temple area, one abrasion, and another one on the.
Okay, so Broken, if you type in chat exclamation join, and then I have to actually add you to the queue to be able to play. But if you do that, then you should be able to play on gamble, exclamation gamble, or exclamation slots. But it may not. It may have closed the availability. I know I didn't close it yet, but you're supposed to start doing that at the beginning of the stream.
Right knee area.
And specifically in regard to bruise number 3, can you tell the jurors where that bruise was located?
Yes, as I mentioned before, this is in the mid-sternum area. Size is like about 5 by 5 centimeter. Circular.
Obviously.
And can you tell the jurors about bruise number 4, which was located?
That's why 8 balls.
Bruise number 4 is on the left side of the abdominal area. We call it flex area.
And what about bruise number 5?
Bruise number 5 is at the left arm area.
And what about bruise number 6?
Bruise number 6 on the left elbow area.
And what about number 7? Can you describe that for the jurors?
Bruise number 7 is on the left, the extensor aspect of the left hand area around the wrist.
And what about bruise number 8? Can you tell the jurors where that was located?
Bruise number 8 is on the right side of the posterior aspect of the arm area.
And what about abrasion number 9? Can you tell the jurors where that was located?
Abrasion number 9 is on the right knee area.
And what about bruise number 10? Where was that located?
On the right legs below the knee joint area.
And what about scratch number 11? Where was that located? Observe any abrasions on Corey's body.
Yes, I saw some abrasion.
Now, calling your attention to the abrasion, specifically marked as 2, can you tell the jurors where this abrasion was located on Corey's body?
Abrasion is on the left temple area, one abrasion, and another one on the right knee area.
Yep.
And specifically in regard to bruise number 3, can you tell the jurors where that bruise was located?
Yes, as I mentioned before, this is in the mid-sternum area. Size is like about 5 by 5 centimeter circular.
And can you tell the jurors about bruise number 4, which was located?
Bruise number 4 is on the left side of the abdominal area. We call it flex area.
And what about bruise number 5?
Bruise number 5 is at the
I think you should be able to do the
left arm area.
in slots.
And what about bruise number 6?
In chat now.
Bruise number 6 on the left elbow area.
And what about number 7? Can you describe that for the jurors?
Bruise number 7 is on the left, the extensor aspect of the left hand area around the wrist.
I think what I just did was gave everybody points to play with. I think that's what I did. I don't know what I did. Don't ask me. All I did was do it. I don't know. Dang. Anarchy has 100,032 points. But I added points to all viewers. 100,000. I believe so anyways. And I believe for 1,000 points, for 1,000 points, you can type, let's see, there's a sound effect that you guys can do, and it's the coins. If you type exclamation redeem, REDEEM. See what that does. So it would be this exclamation REDEEM. And that's for 1,000 of your points. I'm having a malfunction. Anarchy should be able to do it probably. She's the one that shows that she has the most points right now. Will my stop the hate video at home? I don't know, Gabba. Who's Gabba? I don't know. Undefined. Mystery use. Undefined. I don't know. Maybe it's because it's not hooked to my StreamYard yet. I don't know. I'll have to mess with that one still a little bit. I don't know about that one. But I don't know. You should be able to at least play slots or all of that. Let me see. Okay, let's start this back up. We'll play with that in a minute.
And what about bruise number 8?
While we watch.
Can you tell the jurors where that was located?
Bruise number 8 is on the right side of the posterior aspect of the arm area.
And what about abrasion number 9? Can you tell the jurors where that was located?
Abrasion number 9 is on the right knee area.
And what about bruise number 10? Where was that located?
On the right legs below the knee joint area.
And what about scratch number 11? Where was that located?
It's on the left legs below the knee joint area.
And what about bruise number 12? Where was that located?
Bruise number 12 is on the right temple area.
Okay.
Now, doctor, can you tell the jurors what your impression was regarding the bruising that you observed to Corey's body on April 1st when you had observed him in the emergency room?
Right. I saw like a multiple ecchymosis.
Let me just stop you there. What's ecchymosis mean?
Ecchymosis means there is some bleeding underneath of the skin for like a few hours to a few days.
And what other impressions did you have regarding the bruising?
Those bruises are in various stages, as I mentioned before. Some of them are maybe hours, some of them are maybe days. I cannot tell you exactly more than that.
Doctor, when Corey was at Jersey Shore, did you order blood work?
Yes, I did.
And was Corey's blood collected on April 1st, 2021 at approximately 10:49 that evening?
Okay.
That's exactly.
So, okay. So what you got to do is you got to put, yep, your bid behind it, or your amount that you want to do it. So it would be exclamation. And mystery would have been up next. Yep. Use mystery, use redeem, undefined. Okay, so up next is mystery. You would do exclamation slots with the amount of points you wish to bet. Inside little arrows. So it would look like this. It would be, oh, wait, I guess I got to type in chat, right? Okay, so it would look like this, S slot. And then inside your arrows, you would do points and then enter it like that, I believe. That's what it would look like. Except for it would not a capital S. And let me just make sure you got your points, because you wasn't added over into queue when I did the store loyalty. So let's see. We want mystery. Why are they here? 100,000. I'll be right back, guys. Somebody's at my door. Just 1 second. Bye to stop.
Yes?
Yes.
Okay. And was there a blood panel for an INR?
INR is the one we're looking for bleeding time, bleeding. Once there's a bleeding, we're looking for, is there a lot of bleeding based on the enzyme level? That is the one we assess, because the concern about bruises on the chest with different stages on the upper part of the body. So we are looking for, is there any bleeding underneath of the skin?
And what about a prothrombin time? Was there blood drawn for that?
Yes, prothrombin time is a part of the assessment for the bleeding.
And can you tell the jurors why this diagnostic procedure was done regarding the blood work?
Because as I mentioned before, we're looking for the bleeding, we're looking for infections, we're looking for, basically we're looking for the basic screening tests. Is there any problem with liver? Is there any problem with kidney? Is there any problem with infections? Those are the things we do this.
Regarding the blood work, did you run a panel for a CBC with a differential?
Yes, I did.
And what is a panel with a CBC with a differential?
Differential, basically, this is within the normal limit. I did not see any significant changes from the normal reference value.
So,
all right, we're gonna have to shut that 8-ball off next time we're streaming a court case, because oh my lord, you have me over here dying. And there was nobody at the door, of course. So it must not have been that important. Good. Bye. Anyways, okay, let's listen.
can you tell the jurors then what were the results of the CBC panel for the blood work?
Does not like you. It's moody tonight, isn't it?
Basically, we look at it white cell count. White cell count is 7.5. That means his result is within the normal limit for the.
I'll tell you, there are actually positive answers on that eight ball in the queue. But now, whether or not you're going to get them positive answers, probably not tonight.
White cell count. And we're looking for the red blood cell count, also within the normal limits.
It's done bad thing.
We look at the hemoglobin, hematocrit value, 12.5 over 37.3. Those are within the normal limits. And platelet count is 329. This is also within the normal limit. If there's a lot of bleeding, platelet counts will change. And some other neutrophil, lymphocyte, monocyte, we look at it. Is there any problem changes, abnormal patterns or not?
Are you joking?
Doctor, what are neutrophils?
Neutrophil is a one type of the white blood cell fighting for infections.
And what was the neutrophil count when the blood was taken on April 1st, 2021, while Corey was at Jersey Shore?
Okay, neutrophil count percentage is 36.1. That is within normal limit. And absolute neutrophil count, that is what basically we're looking for infection if he has body resistant to fight the infection back. This his absolute neutrophil count is 2.7. That is also within normal limit.
Okay. Did you also run a metabolic blood panel?
Yes, I did.
And what is a metabolic blood panel?
Metabolic blood panel is we're looking for the electrolytes, sodium, potassium, and as I mentioned before, basic renal function, basic liver functions, and
Doctor, I'm sorry, could you just talk up a little bit? I'm sorry, I'm having trouble hearing you back here.
okay. Basic panel is we're looking for the electrolytes, sodium, potassium, and we're looking for liver function. We're looking for kidney.
Can I offer law and crime a little bit of advice? Get better audio stuff. Get a better mic. You know, come on, this is bad.
Function. They all are basic tests. Also looking for is the patient is dehydration or some other problems. Is there any abnormal electrolytes or imbalance? Patient do not have significantly changes on his basic panel.
So what were the results of
again.
Metabolic blood panel?
I look at it, all of those. My impression is he's slightly dehydrated. That is matched with the history. Patient was in the at home. I believe spoke with the Child Protection Agency at somewhere around 11 o'clock in the morning. He didn't eat anything. He didn't drink anything. Come to emergency room about 9 o'clock. So like at least more than 7 to 8 hours. Kid is not eating, not drinking. So that basic panel matched with the mild dehydration condition.
Now, doctor, how many times was Corey physically examined while he was at the emergency room?
3 times.
And why would he be examined 3 times?
This is our normal routine procedure. When the patient come in, residency the first time, I see the patient second time, third time before patient discharge. I have to go back and do the examination again, review the lab result, review the vital sign, discuss with the mother, and let her know about the plan, what will be the next. That's why we have to do 3 times.
Doctor, at approximately 11:01 p.m. on April 1st, was there a skeletal bone survey conducted at Jersey Shore?
Yes.
And can you explain to the jurors what a bone survey is?
Bone survey is we try to look for the skeletal and upper part of the body from head to toe. We do like a 19 radiographic examination, X-ray, scar X-ray, chest X-ray, abdominal X-ray, all the 4 limbs X-ray, looking for is there any rib fracture, is there any other mass, is there any other bleeding inside, or chest is clear. Those are the things we did.
And without telling us what anyone said, why did you order the skeletal survey?
Because we got a history saying that they want to make sure patient is not abused. So if we do the skeletal survey will let us know is there any previous fracture or any injury, because X-ray will show different stage of healing if patient has a broken bone. If patient has an acute condition, it will let us know about this. That is the reason I did skeletal survey.
So when a survey is done, about how many radiographs are done?
19 radiographs.
And radiographs are what, doctor?
Radiograph is X-ray.
And can you tell the jurors what the findings were regarding Corey's bone survey?
Yeah, his bones normal and soft tissues are also normal. His lungs clear and other part of the examination within the normal limit and no evidence of acute fracture.
Was a chest X-ray done, doctor?
Yes, it does.
And what were the conditions of Corey's lungs on April 1st?
His lung is clear. We did not see any infiltration, any signs of injury. Did not see anything.
Now, based upon the physical examination of Corey, his blood work, and the bone survey, what was your discharge plan?
Discharge plan is at this moment, he does not have any acute emergency condition. He can follow up with the child abuse specialist. So we medically clear and discuss with the social worker, that is the child abuse team, and we discharge the patient to follow up with the child abuse specialist.
And was there an on-staff child abuse specialist at Jersey Shore?
Yes, we do.
And was he there the evening of April 1st?
He was not available.
And why was he not available?
Because this is a nighttime and weekend.
Now, based upon your physical examination of Corey, the blood work, and the bone survey, did you medically clear Corey for release from the hospital?
Yes, I did.
And was Corey ever admitted as a patient from the emergency room?
No.
And while Corey was at the emergency room, did you speak on the telephone with a DCP worker without telling us the conversation?
No, we did.
And based upon this conversation, was Corey cleared to be released to his mother?
Yes.
And Corey was discharged a little after 1 a.m., correct?
Yes.
So he would have been discharged then on the early morning hours of April 2nd.
Yes.
Of 2021.
Yes.
And when you
So he was good enough to be released into his mother's care at 1 a.m. the morning he went to the hospital. Or the
Corey
night.
from the hospital, did you observe any symptoms of sepsis or infection or broken bones or any of these things?
No.
So no sepsis, none of that was within a realm of possibilities that would have caused his passing away. The possibility is there, but at this time it's a wait and see kind of thing. Try hard. What is up with the try hard? I don't understand. I just can't. I'm pretty sure that I'm mistaken your door for mine. It's my room service. Yeah, maybe that's what it is there. Something to talk about. Maybe. Correct. He had several tests done that were normal. No sign of infection. That's right. So the simple fact that what the defense is using as a defense, it's absolutely absurd. But I guess finding a medical examiner to even go and testify that this could be the cause, that's crazy, because if that's really not what caused it, then they're technically lying under oath. It's got me all sorts of effed up tonight. Yeah, tell me about it. Keepo, Napo, and try hard. Yeah, I don't even understand. It's crazy. It's in a mood tonight, that's for sure. But well, that ends that one, guys. So with that being said, I guess we're pretty well caught up for the most part. I think that's what I'm gathering, at least for what's out there. Let me look. Let me see, because we can always come back tomorrow and pick up. This is 5 hours ago, but I'm guessing that this goes back to the mom's testimony. And I'm pretty sure we heard all of that. Was that the only one we missed? Yeah, I think so. Let me see. That's him at the hospital. We've seen that video. During the testimony of the autopsy photos. Okay, so here this is 9 minutes. We can quickly watch up on this. The alleged child killer calls CPS on son's mother. Well, we can catch up, or otherwise we can get back together sometime tomorrow morning and catch up on these little clippets that they have here. They have a few of them. Let's see. This is the mom. That's her testimony. We've seen all of that. Well, actually, it would be these two that we haven't been caught up on. The CPS calls, which is 10 minutes, and the accused killer cries during testimony autopsy photos. We could go ahead and knock those out the park, and then we'll be all caught up. What you guys think? Did they put a posse in it? I don't, Dave. Who knows? It's up to you guys. Do you guys want to just knock these two? It's a total of 19 minutes. Wonder why talk takes spelled your name like that. That's weird. What do you mean? I'm fixing to do a game step on my channel. Little mystery. You got to come up on panel and do it with us. Okay, well, we can do that. When are you doing that? Do we got enough time to finish up these videos? Something to talk about? And then we can all just go right on ahead on over to your channel and do that game. For the most part, I'll probably play through these videos. Maybe comment once or twice, but let's go ahead and start with this.
That is the person calling about. Her name is Brianna, B-R-D-A-N-N-A, same last name.
Same last name as Corey?
Correct.
Okay, and where is she with that?
I am unsure.
Do you have a phone number for her right there?
I don't have it readily available. you guys have been involved numerous times with us, so I'm sure that it's in the documentation somewhere.
All right, and what were the concerns today for the child?
So essentially, his mother has put in an emergent application after filing.
For updates, bro?
Yeah, so she essentially filed with these allegations, which there's a worker that had to be involved. The worker that came out of the house unannounced for the first visit, had discussed with my son privately what happened to the solution that he had. My son had described that it was from football. Now, I told you yesterday, actually, it was last weekend, my son's mother had the entire weekend, and she had called me on Friday. She called again on Sunday, which kind of made sense in my mind, considering she had been that entire time. Nonetheless, now that's what we're seeing yesterday. Yesterday, the CCTV workers that we have been working with, told me that my son needs to get an evaluation done within 7 business days or 7 days, excuse me. His son's mother then decided that to take it upon herself during the 3 hours yesterday to take my son to the doctor to the hospital, and she just went into silence essentially from 7:30 until 1 o'clock in the morning, and I had no idea what was going on. She would not leave my son's side, and I was not able to be there for my son. And then furthermore, my son came back this morning, and he was saying to me that his mom said that he had to tell the doctor that I hit him, and things of that nature, and coaching him. I had called his worker, but of course he's not answering. She said that his worker told her to disregard the visitation and to go to the hospital. So, which I imagine is not the case. Considering that up to 7 days to do so, that didn't have to be done the same day and against a court order.
Yeah, and I can tell you that even not knowing the case at all, it's not something that CCTV would, restrict any sort of contact without any sort of documentation or court order involvement, kind of stating that. So that does not appear accurate. But and I can obviously know what you're telling me, and I know that the worker didn't answer, the worker is probably well disclosed that. So this information will get, passed on to a worker, that way they can see this information as part of the case, but no, there's nobody available at this point in order for you to speak to.
No, and I figured as much, but I wanted to document that my son had came home today after he was supposed to come home at 7:30 last evening. His mother refused to leave the side, so I was not able to be there for my son. And he said it was at the direction of DCPD. And furthermore, the big issue for me is, she put in an abuse allegation, she's done over a dozen times. And every single time he has said that it is not the case. He has said it to the worker twice, once on Friday, once on Sunday, for the worker came back out. Now, after she had me for an extended period of time yesterday and had him at the hospital and was coaching him to say that I hit him, he said, so my big concern is just, that her coaching is going to be disregarded, is going to be regarded in his statement.
I don't definitely know what you're saying. The worker has to take all things into account. And I have to speak for
Listen, I'm so angry about this. I'm over here talking and didn't even realize I was muted. Anyways, it's like infuriating because he is over here reporting this mother for taking the son to the hospital, especially knowing that they were ordered by the courts, by the judge, magistrate, whoever it may be. They were ordered by the court system to take that child in. She was only doing what she was told to do. Now, whether or not the father showed up or not, I've said it once, said it twice, said it a million times. That was on him. It didn't matter. Uh-oh, we're getting some thunderstorms. Yeah, we've been getting them really bad lately too. Something. Yeah. Be careful. But I don't know when you plan on starting your stream, but I'll be there once we're done. Let me finish this one up.
how the case itself is going to be managed, but I mean, I will note everything that we're talking about and make sure that the worker gets copies.
Yeah, because realistically, the worker has spoken to my son at my residence, and my son's very comfortable here, so there's no issues with that. And my son, I need to know the worker was coming. So even if I wanted to do something like she did, and coach, my son would say a particular thing, I had zero time to do so. So, I just wanted to document that he came home and one of the first things first two things he said to me is, I don't want to go with my mom anymore. She's going to try to take you away from you. And then he also said that, mom told me to lie, I had to lie. And that was a huge concern of mine.
I'll definitely make notice. I do have some mandated questions to ask you about your household, as well as mom's household. If you don't know the answers, you can just tell me that you're aware.
Sure.
All right, what's the race and language of everybody involved?
White and English.
Any domestic violence, criminal history, or current substance abuse issues for anybody?
None of my household, their household, yes. The mother has significant substance abuse issues with methamphetamine, amphetamines, and heroin. And I actually am highly concerned that she's relapsing at this time.
You know, I was thinking the same thing, JL, that he sounds like he's scared that the son might say something or along that line, because why else would you? I mean, I don't know. That's so dumb to be calling CPS. I hope that while making this phone call, he at least added that. Oh, and by the way, we were ordered by the courts to get him seen at a pediatrician. You know, what a piece of crap, man. Look at him on the court. His action.
He's very right, and it's extremely out of character for her. So there's no rationale.
Any special needs, disabilities, or diagnosed mental health issues?
Well, also I wanted to see that the mother's sister, so my son's aunt, who by court order is not supposed to be around my son, is around my son, and she just got out of jail for drug charges. And then there's also the criminal grip.
Any indication that the aunt is moving around the child, and what's her name actually?
Her name is Nicole, Mitchell, and Leslie. No indication that she's moving around things, at least that I'm aware of.
What are you going to say about grandparents?
Maternal grandmother's boyfriend was at the household with a 2-time felon, convicted felony of assault. And he's bipolar, not supposed to be there as well, but he is every time I come to church.
All right, and related to mom's drug issues, I know you said that you believe she relaxed. Any indications aside from acting erratic, irrational, like anybody say they saw her influence or any specific evidence of her using drugs?
Not specific evidence in that regard. Also, she started hanging around the ex-boyfriend who she was living with. She's been around my son as well, which is also next court order.
Any safety concerns that your home for a worker? Any animals, weapons?
No, not I'm aware of.
Any child prostitution, pornography, or forced labor by anybody?
Not here, and not that I'm aware of over there.
Any international travel for anybody within the last 14 days?
No.
Anybody either having COVID-19 or suspected to have COVID-19?
No.
And anybody having any serious respiratory infections, cough, sore throat, anything like that?
No, but going back, I remember you asked a question about mental disorders and things like that. The mother had PTSD from being bullied in middle school, and my son is diagnosed as emotionally disturbed with classification having lived with his mother based on the past aggressive behavior he showed, which does not exist anymore.
And I know he's with you now. When is the next time he's due to see mom?
I believe it is next Tuesday.
What time, you know?
7:30, but knowing her is going to go over, she'll find an excuse to justify bringing the forward again.
And that contact that she had with him, when it happened, did it unsupervised?
Yes, correct.
All right, so this is going to our Ocean South office. That way they have this information, as documentation. Is there anything else I can do for you?
No, that's really it. I'm just, worried that if she coached him to say something, he came home and told me it, but, maybe it's going to be considered, and it's just a huge concern of mine. On top of everything else.
Well, I hope everything does work out. That's all you need to do is notification.
Thank you, no, there's it.
You're welcome. Bye.
All right, so there's that. No, we weren't live. We were just trying to figure out that murder mystery game. Oh, okay. I was just making sure. I'm like, girl, you better run from her because she's gonna come for you. All right, so let's go there, and this is the other one.
Any other involvement did you have in this investigation?
We wrapped up after that, and then the next morning, which would be later in the morning after the search at Englishtown, the autopsy was conducted at 9 a.m. on Saturday the 3rd.
April 3rd?
April 3rd.
Okay. And did you go to that?
Yes.
And when you went, where was that located?
Community Medical Center in Tom's River.
And when you got there, was anybody else there, or did you go with anyone else?
There were 2 detectives from my unit, Detective Daniel Lesnikowski and Detective Ralph Laudicina, as well as Detective Purcell from Barnegat Township Police Department, Detective Dennis Mitchell, Detective Joe Mitchell, Sergeant John Carroll, and Lieutenant Brian Haggerty of the Ocean County Prosecutor's Office.
Now, while you were there, what was your understanding of what your role was?
So our role in the autopsy is we basically work hand in hand with the medical examiner, which was who does the autopsy, and we do all the photographs and collection of any evidence from that autopsy.
Were photographs taken?
Yes.
Who took the photographs?
Detective Lesnikowski.
And were you in his presence while he was taking them?
Yes.
And who directed him to take the photographs that he took?
We have a set of standard photographs we take on every autopsy, then everything else after that is done at the direction of the medical examiner, pathologist conducting the examination.
Judge, may we approach that so I could show the portrait pictures first? Thank you.
Okay, so I'm guessing we're doing a little sidebar here in court, whatever that may be. Getting ready to show those photographs of the autopsy. Let's see. Sidebar. Group meeting. Somebody asked the 8-ball what they are actually talking about. I love when people say, I have a 4x4. People say, I have a 4x4. I say, so you have a posse? They say, no. Oh, okay. So, yeah. So you don't have a crossover. Yeah, right. Judge has to pee or has a wedgie. You think so, Dave? Maybe that's what it is. Maybe. I don't know. We'll have to figure it out. They look like they're hardcore in some discussion over there. Let's see. Let's speed this up a little bit. Get back to it. Wait, that guy's rubbing his face. Look at him. He didn't look like he was getting good answers. All right, come on. What are we doing now? Why does he have the headphones on now? Are those earplugs? So he don't have to hear what's being testified to? Well, he better hope he has to listen to what this autopsy says. Or you can
Members of the jury, Ms. Strong has a few more questions, and we'll probably break for lunch at that point, but we have a few more minutes, so Ms. Strong, please proceed.
So you were saying that when you go to the autopsy, your purpose there, part of that is to take photographs, right?
Correct.
I think you had said that some of them are standard and some of them are at the direction of the medical examiner.
Correct.
Okay. When you first get to the autopsy, before you begin your pictures, could you tell me what happens?
So
what happened in this one?
So the deceased is transported from the location of incident, which in this case was Southern Ocean Medical Center. We seal the body bag. Every body bag is identified and sealed. The decedent's information. It also is the seal numbers placed on the bag, and also in very large letters, do not open. So that bag is basically now treated as evidence from Southern Ocean Medical Center to Community Medical Center. We have a funeral home. We have funeral homes on contract that transport for us. So in this case, he was transported to Community Medical Center, where he is then placed under the care of their security and morgue, where he's signed in, kept in the morgue, and remains there until we arrive for the autopsy the next day.
When you arrived for the autopsy the next day, what was the procedure initially?
So the initial procedure is the bag is brought into the examination room, placed on a table, and we then rephoto that bag as we last left it, which would be sealed and marked. We then rephoto all that again, and then the bag is then unsealed by the medical examiner's personnel to begin the examination.
Okay. And was there a name and markings contained on that bag?
Yes.
Okay. What were those, if you could tell me?
It would be the name Corey Mitchell and his date of birth, social security number, the bag time, who bagged it, and the seal number.
And all those things were present on there when you arrived at the autopsy?
Yes.
And were they the same or substantially similar to the hospital the night before?
Yes.
Now, after you photograph the bag in that condition, what is the next part of the procedure, generally speaking?
So the next part of the procedure is we open the bag. That seal is broken. As I said, once the doctor's ready to begin the examination, the bag is unzipped, and we do a overall photography and examination of the body as the way it was, because this is now the first time the pathologist is viewing the body.
Does it look like he's forcing on the emotions, or do they look legit? Let me know down in the chat.
So some of the photographs are
Also, remember to like this stream.
taken then at the onset before the autopsy begins.
Correct.
Okay. Are there more photographs taken after those initial ones?
So the first one would be as he was. The second set would then be after all the medical equipment, clothing, and any jewelry or anything else is removed.
Is there another set that's taken after that?
Then after that, we do the posterior of the body, and then that is when the examination begins. And the doctor then pretty much runs the show from there and what pictures are taken.
And then do you take pictures during the actual examination?
Yes.
No way. You're joking, Dave. Like, I had to read that over and again just to make sure I read that right. You're crazy. That is no way. I don't know. And his reaction is he didn't show any during the treadmill incident. Yeah, you're right. You're absolutely right. He sure didn't. I would like to hear more into the testimony of the autopsy. Why won't they show more? This is angering me. This is really going to anger me. Like, why can't we find more into the debt? Okay, guys, I'm going to probably close this down here. I'm going to see if I can't find some more testimony from the trial that we may have missed over day 3. This is day 3, all of day 3, it sounds like. We might have to go skim through some of this tomorrow. We will gather back tomorrow and we will further go into this, okay? Because it does say day 3, there's more. Yeah, see, there's 5 hours on day 2 and 6 hours on day 3. So we're missing a good proportion, but I'm going to save this in my watch laters right here. So there's almost 7 hours that we'll have to go through there. And I think we got most of day 2 covered. So I'll look into that. And if we missed anything, I will pull that up for the most part. And then we will be fully caught up, okay? How's that sound? We can gather again sometime tomorrow and we'll go further into day 3 in that 7-hour stream that we may have been missing. Maybe because the autopsy info is too graphic. I don't know. I think they just like what we watched was little clippets of part of day 3. Because as you've seen when I was looking through the options of watching, I did see where there was 7 hours approximately of court today. So she resigned and went to work for a law firm on people on death sentences. Really? Really? That is crazy, Dave. You find all these weird and interesting case happenings all the time. You're good at doing that kind of research. Let me say that. But with that being said, guys, I'm going to go ahead and end it here as we're already approaching on a 3-hour live stream. Like I said, I don't want to make it too long because you don't get very many that want to come back and watch the real long lives. So thank you for coming, everybody. And I do want to thank Something to Talk About for the $5 super chat. Cement Shoes for 6 months of membership. Something to Talk About for 6 months of membership. Something to Talk About for the $5 super chat. And for the $2 there, looks like $2 there. And I think I got them all. Thank you so much for all of your donations and for your memberships to the channel. It's greatly appreciated, more than you know. Thank you, thank you, thank you, thank you. And with that being said, you all have a wonderful night. Remember, stay loyal, stay true. Stay you. Love you. Bye.
I don't listen to the haters, man, I treat them like the enemy. Had a couple traitors, man, but now they know the penalty. I tell them, see you later, fam, I do not need this jealousy. I got no time for failure, man, I wanna leave a legacy. I walk in and I'm sold out, pop up for the whole crowd. I got this, I roll out, I promise, have no doubt. I'm all in, here I go now, call in, you fall out. Take hostage, the pros down, they novice when I throw down.
We gon' make it all the way. We don't care what they all will say. Don't listen to the hate, no. Listen to my fate, yo. Destined to be great, yo. We gon' make it all the way. We don't care what they all will say. Don't listen to the hate, no. Listen to my fate, yo. Yeah, we like to go.
Put me on ESPN, put me on top of the tank. Pilots again and again. No way in here to make friends. Taking it straight to the bank. I'm like a shark in a tank. And if your girl misbehave, I'll give your girl a mistake. That's making me out of my head. I don't belong in my bed. I should be famous instead. I will not stop till I'm dead. Never let them hate. Tell them I'll be great. It's gotta be my fate. You can take it to the bank. I just wanna get it while I can. And when I get it, I'll be damned if I'ma let it get away without a fight. I got a plan.
We gon' make it all the way. We don't care what they all will say. Don't listen to the hate, no, listen to my fate, yo. Destined to be great, yo. And we gon' make it all the way. We don't care what they all will say. Don't listen to the hate, no, listen to my fate, yo. Yeah, we like to go hard.